she did her AMH and she did her AMH. She did her AMH test and the results are showing that AMH was actually 4.5 and then her FSH was actually 7.0 and then also her estrogen was 120 picograms per milliliter. She's asking herself, what does this mean? Mukwano gwaffe yakoze test ya hormonal test, yes, fertility hormonal test, naye ng'ate results zalaze nti AMH hormone yabadde 4.5, FSH yabadde 7.0, LH yabadde 8.0. ali kwebuuza bino biba bitegeeza ki, results zino ziba zitegeeza ki. So in this live session specifically, I'm handling the fertility hormones. If you have been asking yourself what are the most important hormones, then in this live session, she's a 25-year-old. She's a 25-year-old and she did the fertility hormonal test and they are actually showing that her AMH is 4.5 and her FSH is 7.0 and she is asking herself, so I'm live both on TikTok and on YouTube. Remember, you can ask your questions in real time and then I'll be able to answer all your questions. Obango badde olina ebibuuzo byonna byonna byoyagala okubanga obuuza osobola okubuuza. So she's a 25-year-old female. She's a 25-year-old and she did the fertility hormonal test and the results are showing that her AMH was 4.5 and her FSH was 7.0, her LH was 8.0, and then her estrogen, Estradiol, was 120. And she's asking herself, what does this mean? She's asking herself, what is the meaning of these results? I'm going to answer this question. Mukwano gwaffe yakoze kye tuyise a fertility hormonal test. Naye ate AMH ye yalaze nti erimu 4.5. FSH yalaze nti erimu 7.0 and then LH yalaze nti erimu 8.0. Estrogen hormone oba estradiol yalaze nti alimu 120. ali kwebuuza kino kiba kitegeeza ki? And today's video lesson, today's live is about a fertility hormonal test report for one of our friends. So mukwano gwaffe ono ali kwebuuza nti results zino ziba ziraga ki? Ngenda kuddamu kino ekibuuzo. I'm going to use both English and Luganda. Ngenda kosa Oluzungu, ngenda kosa n'Oluganda. Obanga obadde olyoke n'olulimi Oluganda, ngenda kuba nkuddamu mu lulimi Oluganda. Obanga obadde olyoke n'Oluzungu, ngenda kuba nkuddamu mu Luzungu. So first of all, AMH hormone, anti-Mullerian hormone, specifically, it is a hormone that is produced by some special cells on a woman's eggs. And specifically, these cells are known as the granulosa cells. AMH hormone is a hormone that is produced by special cells on a woman's eggs, specifically on a woman's special cells called granulosa cells. And specifically what AMH does, it shows or it gives a clue on the quality of a woman's egg reserves, and then it also shows whether a woman has higher chances of getting pregnant or not. So she did the fertility hormonal test and the results are showing that AMH is 4.5, FSH is 7.0 and LH is 8.0. Estrogen was 120. Estrogen was 120. She's asking herself, is this normal? So when a woman has done the fertility hormonal test report and the results are showing that her AMH is 4.5, remember the normal AMH is actually supposed to be at least 1 up to 4. 1 up to 4, this is according to the World Health Organization. The normal FSH is supposed to be at least 3 up to 10, and then the normal LH is supposed to be at least 2 up to 12. She did also the fertility hormonal report and the results showed that her estrogen was 40, her estrogen was 120. She's asking herself, is this normal? Mukwano gwaffe yakoze test ya fertility, naye ate results zino zaalaze nti AMH hormone ye erimu 4.5, FSH erimu 7.0, and then LH erimu 8.0, estrogen erimu 120. Ali kwebuuza kino kiri normal oba nedda? AMH being 4.5 simply means that it is actually slightly high because the normal is supposed to be 1 up to 4. And then FSH being 7.0, the normal is supposed to be 3 up to 10. Specifically, this could mean that probably she's actually very, very normal, because if the normal is 3 up to 10, then actually this simply means that her FSH is within the normal ranges. Remember, obanga obadde wakatwegattako osobola okubanga obuuza ebibuuzo byo, nja kuba nkuddamu. Buuza ebibuuzo byo mu comments, nja kuba nkuddamu. So mukwano gwaffe alina emyaka 25, yakoze fertility hormonal test naye ng'ate results zaalaze nti AMH erimu 4.5, FSH erimu 7.0, LH erimu 8.0, and then estrogen erimu 120. Ali kwebuuza kino kiri normal oba nedda? AMH ye hormone eyambako ennyo omukyala oba eyambako ennyo okubanga eraga omutindo ogw'amagi ag'omukyala gaba alina oba gaba asigaza. AMH results ziba zindicatinga nti omukyala ono alina amagi agamala obulungi, tugayite follicles, oba amagi ge gaba tegamala bulungi. Yakola test eno eya AMH neraga nti ali mu 4.5. Jukira normal erina kubeera 1 up to 4. So normal ebanga erina kubeera 1 up to 4 nabanga yafuna 4.5 kiba kitegeeza nti yali erinnyemuko katono. Next, FSH yafuna 7.0. The normal FSH hormonal results are supposed to be at least 3 up to 10. This is according to the World Health Organization. Obanga olikwebuuza FSH obanga ofunye 7.0, normal erina kubeera etya? Normal erina kubeera 3 up to 10. So obanga wafuna results neziraga nti oli mu 7.0 kiba kitegeeza nti eri actually within the normal ranges. And then LH hormone yafunye 8.0. Normal erina kubeera at least 2 up to 12. So this actually means that she is within the normal ranges. Okay, we have friends who have come in on TikTok. Remember, I'm live on TikTok and on YouTube. So the first question is coming in from Lima, and she's saying that she's 14 days past ovulation and 1 day late and having negative results. Mukwano gwaffe bamuyita okay, Lima abuuziza n'agamba nti amaliriza ennaku 14 okuva lwe yava mu ovulation naye ng'ate alikola test eya okay, alikola. We assume she did the HCG pregnancy test and she's actually showing that she's negative. She's asking herself what could be happening. Alikwebuuza nti kulwaki amaze ennaku 14 okuva lwe yava mu ovulation naye ate results ez'olubuto ziri kulaga nti tali lubuto. She's 14 days past ovulation, but the test results, the HCG pregnancy test results are showing that she's not pregnant. 14 days past ovulation and then the results are showing that it is actually negative. It could actually be a sign that maybe it is an indication that you could actually be patient and then do the test at least after missing your periods, because you said that you're 14 days past ovulation. 14 days past ovulation means that probably maybe you've not yet seen your periods. You ovulated and then it's basically 2 weeks after ovulation. The answer is that you actually be patient and then you'll do the HCG pregnancy test after missing your periods at least 3 to 4 weeks. Agambye nti amaze ennaku 14 okuva lwe yalaba okuva lwe yali mu ovulation naye ng'ate alikola test pregnancy test results, alikola pregnancy test naye ng'ate pregnancy test erikulaga nti tali lubuto. Ne mugamba nti kyandibadde kirungi at least n'alindamuko n'abanga at least missing periods and then ajja kuba akola test ey'olubuto at least esobola okulaga results ennungi. So be patient, wait until you miss your periods and then you'll be able to do the pregnancy test. Okay, yeah, 14 days after ovulation it could actually be that you've tested very early. Be patient until you miss your periods. The best way to confirm that a woman is pregnant, she waits until she misses her periods, and then after missing her periods she does the pregnancy test 2 to 3 weeks after missing your periods. So answer nti at least abeere nga alindamuko asooka missing periods ze then akole test ey'olubuto. Yes. Okay, Bobo, thanks for joining. Eddie, thanks for joining. Milky, thanks for joining. Remember, you can ask your questions in the comments. Buze mu comments njakuba nkudamu. Yes. The first question was about that, and started cramping 1 week after. Okay, she's also talking about cramping 1 week after ovulation. The cramping pain, the cramping you were experiencing could actually be connected with the whole process of ovulation. Agambye nti abadde afunamuko ne cramping, afunamuko n'obulumi okuva lwe yaba mu ovulation, n'engamba nti obulumi obwo mu luzungu kye bayita middle schimmer's pain kiba kiraga nti era still yandibanga abadde yakamaliza ovulation nga changes ezo ezatekinga place ez'okuba nti egiri avaayo, changes ezo ezibeerawo ng'egirivuddeyo mu kasawo or zibayita ovulatory changes. It is still a normal finding. You actually need to relax, wait until when you miss your periods. Okay, so the cramping was it's a normal thing. Many women experience this. Okay, and then AJ, you are most welcome to today's live session. AJ, nkwaniriza nnyo ku live session ya leero. Obuzza n'ogamba nti can you take Clomid? Let me try to check. Okay. I believe if you are asking about Clomid, the best advice is that you actually need to be evaluated by your doctor, who will do the proper tests and then confirm whether you are to take Clomid or you are to take any other medication. Please do not self-medicate do not self-medicate. Much as Clomid has helped many women, Clomid is helping many women, but don't just go to the pharmacy and buy Clomid, because you could actually end up getting the side effects of Clomid. Because we know very well that Clomid is one of the medications that is actually used in fertility clinics to actually stimulate or to bring about the whole process of ovulation, to bring about the whole process of increasing a woman's chances of getting pregnant. So the best advice is to actually first visit your doctor, who will do a proper assessment on you, and then your doctor will decide whether you are to go with clomiphene citrate or with any other medication apart from Clomid. Mukwano gwaffe abuuza n'agamba nti asobola okumira Clomid oba nedda, n'engamba nti first of all weewale nnyo okubanga okola kye bayise self medication, n'engamba nti kirungi nnyo n'osooka n'ogenda ewa doctor wo, n'ogenda ewa omusawo wo, n'asooka n'akola tests ezeetaagisa okukonfaminga oba weetaaga okumira Clomid oba nedda. Togenda bugenzi n'olaba nti ogula buguza eddagala liyinza ate okuleeta kye tuyise side effects. Okay, and then of course ate side effects zino mwe muli effects nga kye tuyise ovarian hyperstimulation syndrome. When you do self-medicate on Clomid, you can easily end up with side effects like ovarian hyperstimulation syndrome. There are also other side effects, okay, of Clomid, but the commonest and the most what could actually be dangerous is what we call ovarian hyperstimulation syndrome. So the best advice is make sure that you go for a proper checkup, and then your doctor will guide you on which medication you are supposed to take. Okay, you could think that Clomid is the best for you, and yet there's some other medication, we call these gonadotropins. There could be other medications that are much more superior to Clomid. Yes, so nemugamba nti wabagenze wa doctor we n'akola tests ezeetaagisa, doctor we ajja kumuzuulira oba ajja amulonderamu eddala maybe erisingako ne Clomid amaanyi, lyetuyita eddagala erigwa mu kika kye tuyise gonadotropins, kuba Clomid lyerimu ku ddagala eryo lye bayise gonadotropins, naye ng'ate yo Clomid agwa mu kika eky'eddagala kye bayise selective estrogen receptor modulators. Ligenda ne lisalako hormone gye bayise estrogen, ne likendeza estrogen hormonal levels. Okay, likendeza estrogen, and then obwongo ne busensinga nti estrogen akendedde, and then it's time to produce FSH and LH, and then of course FSH ne LH naayika mu mubiri gwo. Jjukira FSH ne LH ze hormones ezigenda ne zikuza amagi bwe gaba gamaze okukula, and then of course ojja kulaba nti chances ez'okufuna olubuto ziba zeeyongera obulungi. So in summary, in a nutshell, kindly make sure that you confirm with your doctor. Your doctor will guide you on the best medication for you after a proper workup. Rose Winter, you are most welcome to today's live session. Yes, you are most welcome to today's live session. Rose Winter, nkwaniriza ku live session yaffe ya leero. I'm called Gerald Massa and I'm a fertility coach. I'm licensed and certified to offer coaching services. I'm certified by the American Society for Reproductive Medicine. So if you do have any questions, you can actually ask your questions about fertility. I'll be able to answer. Obanga badolina ebibuuzo byonna byonna osobola okubuuza nja kuba nkuddamu. Our topic for this session was about a friend. She's 25 years old and she did the hormonal tests. Her AMH was 4.5. Her FSH was 7.0 and then her LH was 8.0. Estrogen was 120. She was asking, is this normal or it's not normal? And I was saying that a lady who is 25 years old with AMH of 4.5, and we know very well that the normal is supposed to be 1 up to 4 according to the World Health Organization, okay? If the normal is 1 up to 4 and she scored 4.5, this could actually mean that there could actually be changes taking place. Of course, she's within the normal ranges, but she's actually within what we call the high normal. I say high normal because she could actually be in the early stages of maybe what we call polycystic ovarian morphology or polycystic ovarian syndrome, but it has not yet developed, okay? It is still in the early stages, but this has to be confirmed by your doctor. Mukwano gwaffe yakoze a fertility hormonal test, naye ate test eno yalaze nti AMH ye erimu 4.5, neŋŋamba nti AMH webanga erimu 4.5, tukimanyi bulungi nti hormone gye bayise AMH oba anti-Mullerian hormone ye hormone evira ddala ku magi ag'omukyala. Amagi gano ag'omukyala galina obutofaali bwe tuyise granulosa cells. Obutofaali buno bwe bufulumya hormone eno gye bayise AMH, amagi gano nga gali kkula. Amagi g'omukyala nga gali kkula gafulumya hormone gye bayise AMH. Normal is supposed to be 1 up to 4 nanograms per milliliter. So yafunye 4.5, kiba kitegeeza nti yandibanga ali ku risk ey'okubanga afuna ekirwadde kye bayise polycystic ovarian syndrome. Naye of course abalina okugenda mu ddwaliro dokita we n'abanga akonfaminga it was normal, but it was a high normal. And then of course her FSH was 7.0. FSH hormone ye yabadde 7.0. N'abuuza nti naye kino kiba kiri normal oba nedda. FSH hormone webanga erimu 7.0, tukimanyi bulungi nti normal FSH according to the World Health Organization erina kubeera at least 3 up to 10, okay? And so you need to confirm with your laboratory reference values. These values keep changing, okay? But the normal is supposed to be 3 up to 10. So if the normal FSH is 3 up to 10 and she scored 7.0, I would say that she's within the normal ranges. This simply means that her brain, that part in the brain called the pituitary gland, it is actually sending sufficient levels of FSH. LH was 8.0. Normal is supposed to be 2 up to 12. That is according to the WHO, okay? 8.0 and the normal is 2 up to 12 international units per liter. This actually also means that her FSH was also normal. These results mean that FSH was normal, LH was normal, AMH was slightly elevated. What does this mean? Number one, this could actually mean that she's actually already very fertile, and then the other thing is that she could actually be at risk of developing polycystic ovarian syndrome. But of course, other tests need to be done to really confirm this. These tests could actually include the androgen test. The androgen test, whereby her doctor could actually look at her androgen hormones, the male hormones, including the levels of DHEA, the hydroepian androsterone, and then of course also including the levels of another hormone known as cortisol, the stress hormone. If these levels are elevated, then it could actually be a sign that she's actually either very stressed or she could actually be at risk of developing what we call polycystic ovarian syndrome. But in the kugamba nti results zino eza AMH ngerimu 4.5, FSH ngerimu 7.0 and then LH ngerimu 8.0 ziba ziraga nti amagi g'omukyala gali kula bulungi, obwongo buli kufulumya hormone gye bayise FSH ne LH ziri within the normal ranges. Naye ate AMH okubanga erimu 4.5 kiba kiraga nti yandibanga ali ku risk ey'ekirwadde kye bayise polycystic ovarian morphology. Polycystic ovarian morphology ye stage esooka ng'omukyala tanafuna kirwadde kye bayise polycystic ovarian disease. ekisawo ky'amagi kitandika okuba nga kikendeera obugine buba nga butandika okubeera nga butono ate ne butandika okuyiwa hormone gye bayise AMH nga nyingi nnyo. And then of course this has been reflected on the lab report. Okay, so let me try to go through other questions. I welcome you all our friends on this live session. I'm called Gerald Massa, and if you do have questions about fertility, you actually are having questions about, you can actually ask questions and then we shall be able to have a chat. Osobola okubuuza ebibuuzo byo obanga obadde olina ebibuuzo ebikwatagana ne issues eza fertility, osobola okubuuza ebibuuzo byo wano ne tuba nga tubayaamuko. Okay, Adrian, you are most welcome. Okay, I'm waiting for questions. If there are no questions, I'm going to go to estrogen. Estrogen hormone was 120. Estrogen hormone was 120. Still on our friend, I will repeat again. Her AMH was 4.5. FSH was 7.0. LH was 8.0. And then estrogen was 120. What does this mean? When estrogen is 120, what does this mean? Okay, we know very well that estrogen or estradiol is one of the fantastic hormones that are actually produced by a woman's ovaries. Okay, we know very well that when the eggs are growing, there's going to be that egg that is called the dominant follicle, that egg that is normally fertilized, that big egg, we call it the dominant egg, that is released on the time of ovulation. Okay, that egg produces two hormones. These hormones are known as estrogen hormone and progesterone hormone. She did the fertility hormonal test and it showed that her estrogen was 120. So if the estrogen was 120, and then we know very well that the normal, according to the World Health Organization, when a woman has just finished her periods, the normal estrogen hormonal levels is actually supposed to be at least 40 up to 150. But this has to, you have to confirm with your laboratory reference ranges. So if she scored 120 and the normal is 40 up to 150, this is actually a sign, this actually means that her estrogen is within the normal ranges. Mukwano gwaffe yagambye nti estrogen hormone ye yabadde 120. Alikwebuuza estrogen hormone ye eri mu 120 oba estradiol eri mu 120, kitegeeza ki? Nengamba nti estradiol hormone webanga eri mu 120, kino kiba kikonfaminga nti actually ali within the normal ranges, kuba tukimanyi bulungi nti omukyala wabanga badde yakava mu periods ze, estrogen hormone oba estradiol egenda kubeera at least within 40 up to 150. And though when she actually reaches the mid-cycle, the levels could change. So if the estrogen is normal, then it means that her eggs are actually growing very, very well. And her eggs, to confirm that they are growing very well, it could actually be a reason why she scored 120. But when it goes higher than 120 and it actually goes up to maybe 160, okay, or even 170, then it's going to send a negative feedback message to the brain, and then it will tell the brain that, you know what, you stop the production of FSH and LH. Mbadde ndikugamba nti estrogen hormone webanga yeyongedde okulinnya nesuukako 150 negenda mu 2 negenda mu 3, then kiba kitegeeza nti estrogen hormone eno kennyini eba egenda kuweereza message oba egenda kuweereza obubaka bwe tuyise negative feedback mechanism oba negative feedback message. Estrogen hormone eba egenda kuweereza obubaka ku bwongo, akatundu ke bayise ka pituitary gland, eba egenda kagamba nti lekeraawo okufulumya FSH ne LH. In other words, obwongo ebulekeraawo okufulumya hormone gye bayise FSH ne LH, then kiba kitegeeza amagi tegagenda kukula. Kitegeeza ki? Kiba kitegeeza yandibanga maybe ayingidde mu ovulation omukyala ono, yandibanga maybe yafunye olubuto, kuba omukyala waafuna olubuto amagi gaba tegakula. Let me try to go through, okay. AJ was asking about Clomid. I said that self-medication is not good, and my advice was that you actually go and confirm with your doctor, who will advise you on the best medication you are supposed to take. Please do not watch a video and go to the pharmacy and buy medicines, because these could actually cause issues. If you do self-medication, you could end up with side effects. So you are advised to always visit your doctor for a proper assessment. I have failed to get pregnant. Can I? Oh, okay. So, AJ, thanks for specifying. You were asking that you have failed to get pregnant, and you are asking yourself, are you, or should you go ahead and take? You said take what? Take Clomid. So you were saying that you failed to get pregnant, but you are asking yourself, should you go ahead and take Clomid? And my humble My humble advice is that please do not self-medicate. Please do not go and buy a medicine and take it. Why? Because it could cause side effects to your body. It could bring side effects to your body. It could bring side effects to your body. Why am I insisting that you visit your doctor? You might think that you are actually going to take the Clomid and then it is going to make you pregnant. Clomid is not going to make you pregnant, because for a woman to get pregnant, it has to be between two people. What if you took the Clomid and your eggs were already very okay? What if you took Clomid and you were already ovulating and yet the problem is with your husband? You see, you would have taken the Clomid for nothing. Then the Clomid could actually bring about effects to your body. The Clomid could actually bring about issues like ovarian hyperstimulation syndrome. Your ovaries could begin developing swellings, ebizimba. Mukwano gaffe abuuza n'agamba nti agezaako okufuna olubuto ali kwebuuza amire Clomid oba nedda. Ne ngamba nti kirungi nnyo n'aba nga asooka n'akonfaminga ne dokita we n'asooka n'akola kye tuyise a proper assessment okukonfaminga kituufu yeetaaga Clomid oba nedda. Ku lwaki nkiremeddeko nnyo nti asooka alabe dokita we? Ayinza okulowooza nti yalina obuzibu naye ng'ate maybe obuzibu buli ku bbaawe. Ayinza okulowooza nti amagi ge tegakula naye ng'amagi ge gali normal. So waba agenze mu ddwaliro, dokita we ajja kola tests ezeetaagisa okukonfaminga kituufu amagi ge gakula oba tegali kukula, kituufu ovulatinga oba ta ovulatinga, enseke ze nzigule oba sinzigule, kuba oyinza okumira Clomid ng'enseke zaaziba, okay? N'ofuna olubuto naye olubuto ne lusigala mu luseke, n'omaliriza ng'ofunye olubuto olw'omu luseke lwe bayise an ectopic pregnancy. You see, my friend, you see why you're not supposed to self-medicate yourself. You see why you're supposed to go and confirm with your doctor. You might take the Clomid and yet your issue is actually an endometrial issue. When the endometrium has been weakened due to inflammatory changes or due to reactions or due to chronic infections, okay? And then you take the Clomid, you get the pregnancy, but the pregnancy gets washed out. You end up getting what we call repeat miscarriages. So you pump yourself with Clomid, but the pregnancies are coming out. Excuse me. You pump yourself with the Clomid, but the pregnancies are coming out. You take Clomid, pregnancies are coming out. It's very advisable that you actually confirm with your doctor, who will guide you on the next steps you're supposed to take, because remember, the TTC journey is a long one for some women, and then for some women it is a shorter one. Some women get pregnant faster, some women take time to get pregnant. You need to identify the root cause as to why you are not getting pregnant. Mukwano gwaffe abuuza n'agamba nti amire Clomid oba nedda, ne ngamba nti agambye nti aligezaako okufuna olubuto naye ng'ate ayagala kumira Clomid, ne mugamba nti ayinza okumira Clomid nga maybe enseke ze zibadde nga ze ziriko obuzibu, n'amira Clomid kituufu olubuto n'alufuna naye ne lusigala mu luseke. Ku lwaki? Kuba teyasooka kugenda kukonfaminga ne dokita we. Ayinza okumira Clomid nga maybe obuzibu bubadde munda mu n'abaana, omwana mwakulira mwe tuyise the endometrium, n'amira Clomid n'afuna olubuto ne luyiika, n'addamu n'amira Clomid n'afuna olubuto ne luyiika. Mu luzungu tukiyita repeat miscarriages. So advise eri nti mukwano togenda bugenzi n'ogamba nti kati mumpe kino, oyinza okuba nga ate weereetera obuzibu, genda okonfaminga ne dokita wo akuli okumpi, ajja kugaidinga ku tests ezirina okukolebwa, ajja kuba gaidinga bbaawo tests ezirina okuba nga naye zimukolebwako. Kuba oyinza okwepika, oyinza okumala gamira empeke naye ate nga obuzibu buli ku bbaawo, nga maybe enkwaso we ziva, maybe mwe tuyise the testis ng'enkwaso mwe ziva maybe zaanafuwa. Oyinza okusanga nga maybe bbaawo enseke zino eziyisaamu enkwaso ze bayise the spermatic tubes, okay? Oba the spermatic ducts, oba nedda part eno etereka enkwaso bagiyita the epididymis, okay? It stores the sperms before they are pushed out before they enter before they are released during intercourse. Oyinza okusanga nga bbaawe yalina obuzibu nga maybe enseke ze zaaziba, kuba n'abasajja naffe tubeera n'enseke, and then of course oyinza okusanga nga maybe bbaawo enkwaso ze maybe zaanafuwa, okay? So kirungi nnyo ne muba nga mukola a proper assessment. I think that's enough about Clomid. What causes low IELT? What causes low IELT? Low IELT. Okay, Giles, you've asked a question about low IELT. Maybe I'm requesting, could you try to like write this in full? Yeah, mkwano gwa fabuza nagamba nti what causes low IELT. It's sort of an abbreviation, and I'm not so certain about this. I'm requesting that you could actually kindly write this in full. Okay, chiwandike in full, then maybe nja kwongera okubanga nange nkimanya. So I'll be able to interpret. So the next question is coming in from Shani. Shani, you are most welcome to today's live session. Shani, nkwaniriza ku live session yaffe ne ya leero. Clots normal during periods. Clots normal during periods. Yeah, friends, keep tapping on the screen. Keep tapping on the screen to confirm that you are on the live session. The next question is coming in from a friend, and she's asking that are clots normal during periods? Are clots normal during periods? When a woman is in her periods, and then she ends up getting clots, okay, heavy clots. Maybe these clots are, yes, I can see you're tapping on the screen. Thanks a lot. I'm really humbled that you've spared some time to be on this live session. Nkwaniriza mukwano gwange ali ku live session yeno, era nebaza nnyo mukama nti office zawo kukadde nobanga oli ku live session yeno kuba ebyokukola bingi wandibadde okola ebintu ebirala naye you are most welcome to today's live session. I'm called Gerald Massa and I'm a fertility coach. So when a woman is in her periods and then she ends up getting heavy clots, when a woman is in her periods and then she ends up getting dark blood, okay, or blood which is actually very heavy, these changes in a woman's periods, normally they could actually indicate that there's something that is not right, okay? So when a woman gets heavy clots, we go back to the two hormones, estrogen and progesterone, because we know very well that these hormones are the key hormones that actually prepare the woman's womb. They are the hormones that prepare the woman's uterus. They are the ones, specifically estrogen hormone, it prepares the woman's uterus in such a way that when it is actually within the normal ranges and it's balancing, her periods will be normal, the flow will be okay, there will be no heavy clots. Is it normal for a woman to have heavy clots? In most cases, it is a normal appearance, it's a normal occurrence. Many women get the heavy clots, but still, it could be a sign that there's something that is actually not right with the two hormones I've talked about, the estrogen hormone and the progesterone hormone. If you are in your periods and then you are having heavy clots, and the periods have gone for like 7 days, the periods have gone like for 2 weeks, okay? Kindly, you actually might benefit from a proper assessment whereby your doctor could maybe go for a transvaginal ultrasound scan or even a pelvic ultrasound scan to really confirm the health, okay? The health of your endometrium. Is it within the normal ranges? Is it within 8 millimeters to 15 millimeters, the thickness of your endometrium? And then could there be other things like endometrial polyps? Could there be other things like fibroids? This was in English. In Luganda, mukwano gwaffe abuuza nagamba nti ali mu periods naye ng'alaba clots normal. Okay, clots ziri normal kubanga omukyala aziraba nga abadde ali mu periods. Ne ngamba nti kirungi nnyo omukyala wabanga ali mu periods n'aba nga yeetegereza nnyo flow ye eri etya, kuba normal periods ziba basically periods eziri normal guba musaayi nga guli clear, okay, pure red, and then omusaayi ogwo ebiseera ebisinga mu bakyala bamu baba bagenda mu periods within 2 to actually 4 days, okay? Mu bakyala bamu basobola ogenda 2 to 5 days, naye obanga ogenze mu periods nga ogenda week namba oli mu periods, weeks 2 oli mu periods, ate nga omusaayi ogwo gulimu ebitole ebikwafu ennyo, ebitole nga bya black, tuyinza okuba nga ate tutunulira nnyo hormones zino ebbiri omuli estrogen hormone ne progesterone hormone. Estrogen hormone ne progesterone hormone olina okuba nga at least wetegereza nnyo fuleno ebanga ebadde ekyusa ennyo ate nga toli kuvaamu mu nsonga zo, kyandibadde kirungi n'oba nga ogenda ewa dokita wo n'aba nga ate akola tests ezeetaagisa okukonfaminga ku lwaki fuleno eri bweti. Dokita we asobola okusalawo n'abanga maybe akolayoko ku scan gye tuyise a transvaginal ultrasound scan oba a pelvic ultrasound scan oba an abdominal pelvic ultrasound scan with more focus. Asobola okufocusinga ennyo ku kana akabubi ke bayise ka endometrium omwana akayeekwatako n'akula, okay? Singa bazuula nga maybe katono nnyo, okay? Oli mu kiseera ekya ovulation, oli mu ku ovulatinga, oli mu yo 14 fide, naye scan eraga nti endometrium yo ntono nnyo terina kulabika, okay? Musawo wa scan ajja kugamba ne endometrium sigirabye, okay? Ate ng'oli mu ovulation ate nga tukimanyi bulungi nti during ovulation endometrium erina okuba nga erabika bulungi, erina kuba nga at least eri within 15 millimeters. Mu bakyala abamu esobola okugenda paka mu 20 millimeters. Okay, so webazuula nti obuzibu buli kuva ku endometrial lining yo, akawo by'omwana kakulirako, Dr. Onazuula nti maybe ne hormones teziri ku balancing, and then of course aba agenda correcting those deficiencies, agenda correcting obunafu obwe buli, and then periods osobola okuddayo mu normal. Okay, estrogen and progesterone hormone. Okay, Bossa, thanks for appreciating. Bossa, yes, thanks for appreciating, and I'm really, very humbled. I'm very happy that you've spared some time and you are on this live session. My friends, keep bringing those questions, keep tapping on the screen so that many of our friends can actually also benefit from this live session. Berango tapping up screen, mikono gyaffe bongera okubanga balaba live session yeno. Tomanya bayinza okubanga no balinayo ebibuuzo bebandyagadde okubanga babuuza. Mbeerako buli lunaku Monday up to Saturday saa 9 paka ku saawa 11:12. Osobola okubanga ojoininga o missinga leero, osobola okubanga ojoininga enkya, oyinza okulaba video nga maybe it is a re-upload nga ngitaddeyo nga maybe nakitaddeyo enkya. Osobola okubeerako ku saawa 9 zennyini on the same channel, Gerald Massa the Fertility Coach. Okay then, mirembe, okay, ya musawo ate okusanuka amabere. I think let me use more of, okay, let me try to simplify this. Omukyala wabanga badde ali mu periods, and then amabere ge ne gabanga gali kusanuka. No, the question is not about periods. Musawo ate okusanuka amabere. Mirembe, maybe ojagezako okubanga like obeera specific. Omukyala asanuka amabere, omukyala ono asanuka amabere. Ayonsa as of now ali mu kuyonsa oba tali mu kuyonsa. Okay, naye kangezeko okubanga nkikavaringa mirundi ebiri, wabanga abadde ayonsa nga amabere gasaanuka, obanga wabanga abadde tayonsa naye nga amabere gasaanuka. So omukyala wabanga abadde ayonsa amabere ge ne gabanga gasaanuka, kiyinza okubanga ate kiraga nti omukyala ono hormone ye gye bayise Prolactin etandise okubanga eri kulinnya ennyo. Of course already ebeera high mukyala ayonsa, naye ate eyinza okubanga eyongedde okubanga erinnya nga obwongo bukitegedde nti ekiseera omukyala ono kyayonsezaamu omwana, katugeze abadde alina muyonsa ku ssaawa emu ey'olweggulo, obwongo busensinga. Okay, akatundu ak'obwongo bakayita the anterior pituitary gland, kafuna obubaka okuva mu katundu akalala ak'obwongo ke bayise the hypothalamus. So obwongo bw'omukyala busensinga ne bulaba nti omukyala ono atusse ekiseera eky'okuyonsa, then busindika hormone eno gye bayise Prolactin nebanga yeeyongera at that particular moment. Jukira hormone eno eyiika mu phases oba eyiika mu pulses. So obwongo busensinga ndi ekiseera eky'okuyonsa kituuse, then it's a normal thing. Omukyala wabanga badde ayonsa amabere ge ne gabanga gasaanuka, it's a normal thing. Kiba kiraga nti obwongo buli kulagirira nti ssaawa ey'okuyonsa etuuse. The next part of the answer, is that omukyala wabanga badde tayonsa, tali lubuto naye ate nga amabere ge gasaanuka, tayonsa tali lubuto naye nga amabere ge gasaanuka, sinakindi amabere ge nga gavaamu n'amata, tayonsa naye nga amata gafuluma, kiyinza okubanga ate kiraga nti buli obutundu obubiri bwe njogeddeko, okuli akatundu akali mu bwongo ke bayise the pituitary gland, anterior pituitary gland, kayinza okubanga ko kali kulowooza nti omukyala ono yafuna dda olubuto. Now ekyo kiba kireeta ekirwadde kye tuyise a dysfunction of your pituitary gland sending false signals. Obwongo busobola okulowooza nti omukyala ono yafuna dda olubuto, then ne butandika okubanga buyiwa hormone eno gye bayise Prolactin gye njogeddeko. Kuba jjukira hormone eno gye bayita Prolactin, hormones bye ebirungo omwana omuwala byazaalibwa nabyo. Hormone eno gye bayita Prolactin webanga eyiise mu mubiri gw'omukyala nejja like negenda mu mabere ge, esitula oba ereeta kye tuyise breast milk production, yereetera amata okubanga gafoominga. So omukyala wabanga badde tali lubuto naye ng'ate amabere ge gasaanuka, amabere ge gali kufulumya amata, kiba kitegeeza nti obwongo kali akatundu ke bayise the pituitary gland, okay, the APG, kayinza okubanga ko kali kulowooza nti wafuna dda olubuto. Kitegeeza ki? Kiba kitegeeza ekyo kiba kirwadde. Ekirwadde bakiyita batya? Bakiyita hyperprolactinemia. Prolactin hormone nyingi nnyo naye ng'ate toli lubuto. Biki ebisobola okubanga bireetera akatundu kano ke bayise the pituitary gland okubanga keeyisa bwe katyo? Kuba oyinza okwebuuza naye ate musawo siri lubuto naye ki ekireese amabere okubanga gasaanuuka? breast nipple stimulation after intercourse. Omukyala wabanga abadde maybe abaddeko ne bbaawe and then maybe mu kikola ekyo ekyokubanga bali wamu ne babanga maybe batuta obudde bungi nga bali kwestimulating, oba bbaawe n'abanga atuta obudde bungi nga abadde ali mu stimulating, okay? Mu luzungu bakiyita romancing. Ne kibanga mubaddemu okubanga bamuyonka ennyo amabeere, omukyala ne babanga bamukiisinze nnyo amabeere nga bamuyonse nnyo amabeere ne bastimulating amabeere ago, obwongo era still busensinga nti waliwo ekigenda mu maaso, waliwo ayonka amabeere. Then of course obwongo bijja kufulumya hormone gye bayise Prolactin, and then of course hormone eno ebanga erinnye kiyinza okuba nga kivudde ku that stimulation taking the place. Next, ekirala kisobola okuba nga kireetera hormone gye bayise Prolactin okulinnya, omukyala amabeere ge ne gasaanuuka, era still kiyinza okuba nga kiri kuva ku ddagala omukyala already lyaliko. Medications, pre-existing medications the ladies already taking. Omukyala abanga already abadde ali ku ddagala erisobola okuba nga ate lireetera hormone eno gye bayise Prolactin okulinnya, nakyo kisobola okuba nga kiviirako embeera eno. Olina okuba nga okonfaminga ne dokita wo okukubanga at least ozuula like eddagala lyoliko lirinyisa hormone eno gye bayise Prolactin oba nedda. Okay? Bakebedde Prolactin hormone leero. Jo wabadde ne bbaawe ekiro yakuyonse nnyo amabeere, Prolactin hormone ne bange eyika nnyo omubiri gwo oba nedda. Kuba oyinza okweteekako ekirwadde ng'olowooza olina obuzibu ne hormone gye bayise Prolactin naye ng'ate kiri kuva ku kuba nti wabaddewo stimulation ekiro. Okay? Nga mwahavinze intercourse ne bakuromansinga and then of course amabeere ne babanga baga like nga galese hormone eno kubanga nyingi oba kiyinza okuba nga kiva ku ddagala lyoliko, and then of course hormone gye bayise Prolactin naye esobola okulinnya ng'eri kuva ku pre-existing medical conditions oba ng'eri kuva ku birwadde already ebiri mu mubiri gw'omukyala omuli obuzimba obutera okubeera mu katundu ak'obwongo ke bayise the pituitary gland, babuyita bu prolactinomas, benign growths in the pituitary gland. Ebiseera ebisinga obuzimba buno nabwo busobola okuba nga bulimba ne buweereza hormone gye bayise Prolactin nebanga nyingi nnyo ate nga kiri kuva ku buzimba obwo. Ebiseera ebisinga oba ogenze wa dokita wo aba agenda kola tests ezeetaagisa okukonfaminga mu katundu kano ke bayise the pituitary gland mulimu ko obuzimba oba nedda. Test bagiyita an MRI scan oba an MRI an MRI scan esobola okulaga exactly mulimu obuzimba oba nedda. Naye bino byonna byonna bikolebwa mu malwaliro amanene, olina okuba nga olaba dokita wo n'akugaidinga. In English, she was asking about breast milk, her breasts kind of like being stimulated and then her breasts releasing milk, and I was saying that in most cases it could be due to conditions that are actually bringing about this. It could be due to pre-existing medical conditions like growths in the pituitary gland. It could actually be due to stimulation. Maybe if she had intercourse with her partner and then there was breast nipple stimulation, maybe romancing, it could actually be among the reasons as to why her Prolactin is high. Okay, and I said that if it's actually happening, it's very, very important for her to confirm with her doctor, who will do the proper tests to really confirm why her breasts are actually doing that. Saturday's cycle, when to start testing for ovulation. Saturday's cycle, when to start testing for ovulation. We get 30, we divide by 2, we get at least 15, and then on the 15th day, we count 3 days back. That means that 15, 14, we are going backwards from 15th day, okay? Because the 15th day is the day of ovulation. So we get 15, we go back 14, we go back 13, and then we go back up to the 12th day. So the days of trying for pregnancy, if you have a Saturday menstrual cycle, is actually from the 12th day up to the 15th day. Mukwano gwaffe cycle ye ya nnaku 3, abuuza n'agamba nti ddi lw'asobola okuba ng'agezaako ebyolubuto, ebyolubuto nengamba nti kwata 3 n'akubisamu mirundi 2 n'afuna 15, and then of course n'ava ku 15 n'adda ku 14 n'adda ku 13 n'adda ku 12, and then of course alina okuba nga at least agezaako ebyolubuto okuva nga 12 paka nga 15. Naye jjukira w'ogezaako emirundi egiwera nga toli kufuna lubuto, obeera ne bbaawo omunakeza ovulation naye toli kufuna lubuto, kyandyetaagisa okuba nga ogendako mu ddwaliro ne bakola proper tests okuzuula ku lwaki toli kufuna lubuto ate ng'obeera ne bbaawo mu nnaku eza ovulation. Ira 256, you are most welcome to today's live session. Ira nkwaniriza, yes, you are not using any birth control, but last month you had periods 3 times. What could be the cause? Periods 3 times. She's not on family planning. She's not using any family planning method, but she experienced or she saw her periods 3 times in 1 month. What could be the problem? We go back to the uterus. The woman is uterus. The woman is womb. Okay? We know very well that the womb is actually controlled by hormones. Okay? Whether a woman is to see her periods normally or whether her periods are to change, it goes back to her hormonal levels. It goes back to her hormonal amounts. Okay? Hormonal levels. Okay? So if her estrogen is fluctuating, if her progesterone is fluctuating, then it could actually be among the reasons as to why her periods are changing. Because to know that these two hormones, estrogen and progesterone, are within the normal ranges, just monitor your periods. Okay? Yeah, just monitor your periods. If your periods keep changing, you are seeing your periods 2 times in a month, then you might actually need to confirm with your doctor about the levels of these two hormones, that is estrogen and progesterone. If estrogen is high and progesterone is low, or if progesterone is low and estrogen is high, you could actually notice this in your flow. So I'm not saying that you have hormonal imbalances, okay? Because basically here we are learning, we are on an educational live show, but the best advice is that you actually might need to confirm with your doctor, who will do these tests to really confirm, is your estrogen normal? Is your progesterone normal? And if estrogen is having issues, or if estrogen is not balancing and progesterone is not balancing, then your doctor would actually go backwards and look at FSH and LH. Are they within the normal ranges? Because we know very well that for estrogen and progesterone to be released, FSH and LH has to be actually also normal. And if FSH is normal and FSH is normal and LH is normal, then it means that estrogen and progesterone are going to balance. So this can actually be done when you see your doctor, who will do a complete fertility panel test on you. Mukwano gwaffe abuuzizza n'agamba nti yalaba periods mu mwezi ogumu, yalaba periods emirundi 3 ng'ali kwebuuza kyava ku ki, ne ngamba nti omukyala wabanga abadde ali mu periods ze, omukyala wabanga abadde alaba periods ze bulungi nga ziflowinga bulungi mwezi ku mwezi, okay? And then of course mu nnaku z'abadde asuubira nga zibadde bitambula bulungi, then all of a sudden periods ze ne zitandika okukyuka. Abadde aziraba bulungi ng'aziraba mulundi gumu, then all of a sudden natandika okuziraba emirundi 2 mu mwezi, emirundi 3 mu mwezi. Kiba kitegeeza nti yandibanga waliwo embeera etateredde mu nabaana, kuba tukimanyi bulungi nti periods z'omukyala ziva mu nabaana. Kiki kireetera n'abaana okubanga efulumya hormones zino bulungi? Hormone bagiyita, kiki kireetera n'abaana okubanga efulumya periods bulungi? Hormones ezicontrollinga n'abaana ziri 2. Waliwo hormone gye bayita estrogen hormone, waliwo hormone gye bayita progesterone hormone. Zino hormones ebbiri ziba tezibalancing obulungi, kisobola okuviirako periods z'omukyala okubanga zikyukakyuka. Of course waliwo eddagala lisobola okubanga listabilizinga periods ne ziba nga zitambula bulungi, naye kiba kirungi mukwano gwaffe ono n'aba nga confirminga ne doctor we n'alaba exactly hormones ki eziri okuleeta obuzibu. Kuba tuyinza okulowooza nti estrogen ne progesterone zeziri okuleeta obuzibu, naye ng'ate obuzibu buli kuviira ddala ku hormones ezitandika process eno hormones ezitandika gundi eno zebayise FSH ne LH. Oba tuyinza okulowooza nti FSH ne LH erina obuzibu, naye ng'ate maybe omutindo gw'amagi gukendedde. Tuyinza okulowooza nti it's a hormonal issue, nga maybe mu nabaana mulimu obuzimba babuyita bu endometrial polyps. Tuyinza okulowooza nti endometrial polyps zeziri okuleeta obuzibu, nga maybe mulimu ebizimba ebirala ebinene bye bayise leiomyomas. Mukyala agenda mu periods aba yakavaamu azeemu. Ayinza okulowooza nti periods zeziri omutawaanya, naye ng'ate ekizimba kyekiri okubleedinga. So kirungi okubanga confirminga ne doctor we. It's actually very, very important for you to confirm with your doctor, because you could think that you are having period changes and yet it is actually an issue with maybe a swelling, like maybe a fibroid, or it could actually be an endometrial polyp that is actually maybe bleeding. Okay, so you need to confirm with your doctor, who will guide you on specifically which next steps you need to actually take. Okay, confirm with your doctor. AJ, you're saying that he take it from okay, but he didn't do any tests after explaining to him. Okay. Wow. So you AJ has again told us that she was advised by her doctor to take it Yes, without doing any tests. And now at this particular point, AJ, since it's your doctor who actually recommended that you take the medication you mentioned, the medication we talked about, since it's your doctor who guided you that you take it, then kindly, it's actually very advisable that you follow your doctor's advice. There's a reason why your doctor advised you to take it. So kindly follow your doctor's advice, and then after taking the medication you were advised, you can actually always go back for a review. Your doctor will be able to guide you on the next steps to take. Okay, so mukwano gwaffe agambye nti doctor we yamuwandikira eddagala nengamba nti kirungi nnyo naba nga agoberera advice eya doctor we, ajja kuba yeyongera okuba nga amuguidinga ku steps endala ezirina okuba nga ziddibwako. So since you were advised to take this medication by your doctor, kindly follow your doctor's advice. It's very important. Okay, yes. So next question is coming in from Mrs. Semambo. Mrs. Semambo nkutumiddeko. Yes, Mrs. Semambo nkutumiddeko webalidde ddala okubeera ku live session yaffe eno eya leero. And when to start testing for ovulation. Oh, Mrs. Semambo, I've just answered. You said that you have a Saturday menstrual cycle length, and I said that you basically divide by 2, you get 15, count 4 days from the 15th day. So you can try from the 12th day, 13th day, 14th day, and the 15th day. Okay, chances are highest. And I said that if you do not get pregnant within those days, it's advisable to actually confirm with your doctor as to why you are not getting pregnant. You are with your partner during ovulation, but you are not getting pregnant. Okay, yes. November, you are asking about how much. Kindly, November, you can actually message me. The numbers are on my profile, WhatsApp only. You can message me on WhatsApp. After the live session, I'll be able to reply. Okay. What brings someone to have headache, dizziness after a miscarriage? Headache, dizziness after a miscarriage. Biki ebireetera omukyala okuba nga afuna headache, omutwe nga gumuluma, then nafuna ne kamunguluze after a miscarriage. It's really very bad that you went through the loss. It's really very bad. We pray that may God comfort you. So normally the causes of headache and dizziness after a miscarriage, we go back to the basics. Okay, we know very well that miscarriage means that there's what we call pregnancy loss before 20 weeks. The pregnancy comes out in the first 3 months. Normally, this is what is known as a miscarriage. If the miscarriage happened and it was due to other conditions, already pre-existing medical conditions like high blood pressure, hypertension, and then maybe it is the hypertension that actually brought about the miscarriage, it could actually be connected. It could be connected with the headache you are experiencing. Mukwano gwaffe agambye nti yavuddemu olubuto naye omutwe gumuluma nnyo, then awulira ne kamunguluze, neŋŋamba nti ebiseera ebisinga wabanga abadde ali lubuto naye ng'ate abadde alina n'obulwadde bwa pressure, nga pressure, obulwadde bwa pressure, hypertension in pregnancy, nga obulwadde buno bwa pressure bwe bwaleetedde olubuto luno okuba nga luvaamu, then kiba kitegeeza nti n'omutwe okumuluma guyinza okuba nga guli kuva ku bulwadde bwa pressure. Kiba kitegeeza alina okuddayo ewa dokita we bakole tests ezeetaagisa bakonfaminge mulimu pressure oba temuli pressure. So if the miscarriage was due to high blood pressure, it could be that the headache is actually coming as a result of the high blood pressure, and actually this needs to be managed. Next, why is she getting headache after having a miscarriage? It could actually be due to the fact that maybe there was loss of blood. Okay, so if at all there was lots of blood lost during the miscarriage, then it could actually connect with the headache. The brain is complaining it's not getting sufficient amounts of blood supply, and then of course the headache could be connected with that. And then of course after a miscarriage there's stress. The headache could also be connected with stress. So kindly confirm with your doctor about the proper tests, and then proper management will be given to you. Ekirala kyembadde ngamba nti omukyala aba avuddemu olubuto ate n'abanga omutwe guli muluma nnyo, kiyinza okuba nga kiri kuva ku kuba nti maybe omusaayi yavaamu omusaayi mungi nnyo ng'omutwe guli muluma just because yaluzinga omusaayi mungi nnyo. Ekirala kiyinza okuba nga maybe ali kuwulira omutwe guli muluma ng'ate olubuto lwamaze dde okuvaamu, oba olubuto lwavuddemu naye ng'omutwe guli muluma, nga maybe kiyinza okuba nga kiri kuva ku kye tuyise stress, okweraliikirira n'okulowooza ennyo ku lwaki olubuto lwavuddemu. Olubuto abadde alwagala naye ku lwaki lwavuddemu. So stress oba okweralikirira ennyo kusobola okuba nga kuli contributinga ku headache. Okay, so neŋŋamba nti kirungi naaba nga ate addayo owa dokita we eyamukozeeko, and then of course dokita we ajja kuba amugaidinga ku ki kyennyini kisobola okuba nga kiri kuleeta omutwe okuba nga gumuluma. Okay, is it pressure yalinnye oba yasse nnyo, alina stress oba nedda, of which management esobola okuba nga emuweebwa. Abanga badde alina stress nga nnyingi nnyo basobola okuba nga bamukansolinga ne bamugaidinga ne bamugumya nti asobola okuddamu ate n'afuna olubuto nga bamaze okuba nga bafollowinga steps eziri advised. Okay, should have periods after, should have Ira, kindly try to rephrase your question again. Ira, ddamu obuuze ekibuuzo kyate. Obuuziza ku periods after birth, omukyala aba nga badde amaze okuzaala, something to do with periods. I don't know whether you're trying to say when is a woman supposed to see her periods after giving birth. Okay, I don't know, but I'm trying to reconstruct your question, but you can still ask your question again. So, assuming that the question is about when will periods appear after giving birth, this actually goes on to, it is a question which is actually individualized. Why? Because if a woman gives birth, let's say a woman gives birth today, and then she breastfeeds exclusively, she breastfeeds consistently, she breastfeeds every day, the chances of having her periods again very early will actually be reduced. She will actually take lots of time. She will actually take like at least maybe even 8 months or even 1 year if she's doing what we call exclusive breastfeeding. If a lady gives birth today and then instead of breastfeeding exclusively, because maybe she's a career woman, she's so busy, she actually maybe even does not breastfeed the child, then she will actually see her periods much more faster. You could ask yourself that how does this happen? We call this the physiology. How does this happen? Why is it that a woman has given birth today? Okay, why is it that a woman who has given birth today is not breastfeeding and then she sees her periods much more faster, and maybe even she gets pregnant much more faster? We go back to the fantastic hormone for breastfeeding. That hormone is known as prolactin hormone. Prolactin hormone. Remember, I'm live on TikTok and on YouTube. So if you're on YouTube, kindly feel free to ask the questions, okay? I'm overlooking into the camera of TikTok just because the questions are very many on TikTok. But on YouTube, you can also ask the questions. I'll be able to reply. So when a woman has given birth, there's going to be prolactin hormone that is actually going to rise. When prolactin hormone rises, it's actually going to suppress the two hormones for eggs growing. Okay, when prolactin rises, it suppresses the production, or it stops the production of the two hormones, that is FSH and LH. So when a woman is breastfeeding, her brain will sense that now she's breastfeeding, and then the brain will command, or it will actually suppress, or it will stop the production of FSH and LH hormone. When a woman is not breastfeeding, okay, she has given birth, but she's not breastfeeding exclusively, or every day or daily, then the brain is going to sense that she's not breastfeeding, and yet at the other time she gave birth, but she's not breastfeeding. So the brain will actually say that, you know what, prolactin is lowering, she's not breastfeeding. Now what we need to do, FSH and LH, you go down to the gonads, okay, go down to the eggs, and then begin telling the eggs to grow, and then she'll see her periods much more faster. I think that's the best explanation I can give, okay? So there could be other reasons as to why a woman can see her periods either earlier or later on, but still let me translate in Luganda. Mukwano gwaffe abadde abuuziza n'agamba nti yazaala naye ng'ate ali kwebuuza omukyala periods ajja kuddamu aziraba eddi. Yes, neŋŋamba nti kisinziira ku rate ki oba ku speed ki gy'akoze kye bayise breastfeeding. TikTok tuligendako ku ka break akatono, then tugenda kuba tweyongera mu maaso. Yeah, okay. Okay, yes, so I hope we are live. You can tap on the screen on TikTok to confirm that we are live. Yes, babadde batututeko mu ka break akatono. Yes, you can tap on the screen to confirm that you are live. So I've answered the question about breastfeeding. Nzemu ekibuuzo ekya breastfeeding neŋŋamba nti omukyala aba ayonsa buli kiseera, omukyala aba nga abadde ayonsa exclusively, periods ze zijja kulwawo okujja. naye wabanga abadde tayonsa exclusively nga maybe yamala okuzaala bw'ati n'abivaako ebyokuyonsa then periods zigenda kujja mangu kuba kiviira ddala mu bwongo obw'omukyala. Obwongo busensinga nti ali kuyonsa, prolactin linnya. Prolactin weba erinnye amagi tegagenda kukula. Omukyala ayonsa amagi tegakula. Omukyala ayonsa amagi tegalina kukula. Okay? Bwe gatandika okubanga gatandise okubanga gakula kiba kitegeeza alina we yamisingamukko okubanga tayonsa exclusively. I hope I've answered this question. You can always keep asking the questions. Let me try to be fast because the questions are increasing. Ngenda kugezaako kubanga nteekamu ka speed ebibuuzo byeyongedde. Ntongo, good evening, how are you doing today? You are most welcome to today's live session. Tongo, tukwaniriza ku live session yaffe ya leero. Yes, tuli kwogera ku issues eza fertility, togedde ku hormones, togedde ku AMH hormone, togedde ku FSH, togedde ku LH hormone, togedde ku estrogen okubanga eri mu 120 kitegeeza ki? LH hormone webanga eri mu 8.0 international units per liter kitegeeza ki? Togedde ku FSH okubanga eri mu 7.0 kitegeeza ki? AMH ngeri mu 4.5 kitegeeza ki? Kyabadde mu gundi mu steps ezasoose. You can always rewatch this video on YouTube. Video eno obanga obadde oli ku TikTok nobanga omissinze live session eno eri almost 1 hour ojja kuba ogenda ku YouTube yange Massa Gerald Fertility Coach ojja kuba oddamu live session eno ogirabe bulungi. Talk about hepatitis B. Talk about hepatitis bambi. Talk about hepatitis Tongo. Thanks for the question. Yes, webale kubuuza ekibuuzo kino ogambye nti njogere ku hepatitis kind of tali so direct ku issues eza fertility, but it doesn't hurt to talk about hepatitis. Basically hepatitis, Hepa and then titis. Hepa comes from hepatic, okay, the liver. And then titis means that there's something wrong. There's what we call inflammation. There's a reaction going on in the liver. Hepatitis buba bulwadde obw'ekibumba, and of which buba bulwadde nga buleetebwa ebintu bingi nnyo, okay? Kuba tukimanyi bulungi nti ebiseera ebisinga we boogera ku hepatitis mutayinza okulowooza nti hepatitis maybe kika kino oba kika kino kuba mulimu types nyingi. There are many subtypes of hepatitis. There's actually hepatitis B, there's hepatitis C, and there are other types of hepatitis, okay? So for a person to be told that they have hepatitis, normally they could have had signs to confirm that they have hepatitis. What could be the signs of hepatitis? Okay, what could be the signs that could point to someone maybe having hepatitis? These signs could actually include itching. The body could begin to itch. Her eyes, I'm using her. Okay, the person's eyes could actually be kind of like yellow. When you look at the palms, okay, the inside of the hands could actually turn yellow. When you look at maybe when this person goes for long call, he or she could actually be passing out lots of yellow, okay? And then still the signs of hepatitis include actually, I've talked about itching, I've talked about the yellowing of the white part of the eye, and then of course there could actually also be other signs, but depending on the stage of the hepatitis. If the hepatitis infection, or if it is due to an infection and it has like progressed and it is in the late stages, it could actually affect the person's brain. But then kwogera ku hepatitis, mukwano gwaffe agambye nti njogere ku hepatitis, nengamba nti hepatitis bwa bulwadde obw'ekibumba. Okumanya nti omuntu alina obulwadde bwa hepatitis, ebiseera ebisinga amaaso gagenda kubeera nga ga yellow nnyo, kano kapaati kana aka white kaba kafuuka yellow nga kalina ddala kye tuyise deep yellow. Ndina okumanya nti omuntu alina hepatitis agenda kuba awulira ajja kuba omubiri gujja kuba gumusiiwa nnyo naye nga okusiiwa okwo tekuba localized nti oba kuli just maybe mu face oba nedda, okusiiwa okwo kuba mu mubiri gwonna guba gumusiiwa nnyo. And then of course ekirala sign endala ya hepatitis atandika okuba nga afulumya kye tuyise diarrhea oba afuna embiro ng'addukana nnyo. And then of course hepatitis oba obulwadde buno bwa hepatitis oba bukuze nnyo busobola okuba nga ate buleetera okuba nga bukosa obwongo, okay? Mu luzungu tuba tukiyita hepatic encephalopathy as in bugenda ku bwongo omuntu asobola n'okutabuka omutwe naye nga ate kivudde ku bulwadde oba hepatitis. Obanga obadde ofuna signs zenjogeddeko, omubiri guli kusiiwa nnyo, and of course amaaso ga yero, ogenda okufuuyisa omusulo gwa yero, yes basobola okugamba nti maybe olina enkaka oba olina ki, naye nga kiba kirungi n'ogenda mu ddwaliro n'olaba dokita wo, and then dokita wo ajja kukola tests okuconfirminga exactly obulwadde buno bwa hepatitis mwe buli oba nedda, omuli test eya hepatitis okusinziira ku obusobozi obw'eddwaliro basobola okukola test ezo ne balaba oba hepatitis B, ne bakola test eya hepatitis gye bayita hepatitis B surface antigen test, and then of course eba confirminga nti hepatitis mwali oba ne baba confirminga ekika ekyo, then doctor wo tumuyite physician ajja kuba akuguidinga ku kyobujjanjabi. So that was something about hepatitis. And of course ne doctor wasobola okukola scan gye bayise an abdominal ultrasound scan okuconfirminga size y'ekibumba, okuconfirminga ensigo ziri zitya, okuconfirminga organs endala ziri affected oba nedda. Yeah, so that is about hepatitis. Thanks Ntongo for asking this question about hepatitis. Yes. Okay, Honey is asking a question and she's saying that what are the effects of taking folic when I'm not pregnant? Okay, what are the effects, or what I would actually I would actually rephrase the question that what could be the benefits of taking folic when you are not pregnant. We know very well that folic, we call this folic acid, is actually a very, very important vitamin. It belongs to a group of vitamins known as the vitamin B group, and it's actually very, very important whether you are pregnant or whether you are not pregnant. So folic will help, first of all, in actually improving the levels of your blood, okay? Improving your blood levels. We call this the HB. You could realize that the normal amount of blood levels in a person is supposed to be at least between 10 up to around 11. 10 up to around 15, depending on the lab. So when you take your folic, it means that you're going to have sufficient amounts of blood levels. Since it's a vitamin, it means that when you take folic, your immunity is going to be very fantastic. When you take folic, the eggs, your eggs, okay? Folic does not directly improve eggs, but it's actually going to optimize, okay? It's going to make, since it's improving blood levels in your body, your eggs are going to be supplied with sufficient amount of blood. And you know very well that that big sac of the eggs, we call it the ovarian tissue. If it's getting sufficient amounts of blood, okay, sufficient amount of blood, then it means that it will actually bring about, or it will provide a good medium of egg growth. In Luganda, mukwano gwa fabuziza ekibuuzo n'agamba nti mugaso ki? Mukwano gwa fabuziza ekibuuzo n'agamba nti mugaso ki ogwa folic omukyala wabanga badde tali lubuto, n'engamba nti folic engeri ekiri nti ekirungo kino kye bayise folic kigwa mu kika ekyeddagala oba supplements zetuyise vitamins, okay? Kiyambako ennyo omukyala oba omukyala ono okubanga abeera n'omusaayi ogumala. Kiyambako nnyo okubanga kiraisinga oba kyongeza kyetuyise immunity ye, okay? And then kiyambako ennyo okulaba nga at least amagi g'omukyalo ono gabeera supplied n'omusaayi ogumala obulungi. Kuba omusaayi genda kuba gweyongedde ng'okoseza folic, omusaayi gw'olina gwe ng'omukyala, kiba kitegeeza n'ekisawo kino eky'amagi kyetuyise the ovarian tissue kijja kuba kifuna omusaayi okumala. Omusaayi ogubanga gumala obulungi, amagi gajja kukula bulungi, okay? Yeah, so folic mulungi nnyo waba oli lubuto oba waba toli lubuto. Folic is very, very important whether you are pregnant or you are not pregnant. Please, you can always visit your doctor who will guide you on the appropriate measurements of the folic you are supposed to take, and then of course also on which type of folic you are supposed to take. You can also message me on WhatsApp. My numbers are on WhatsApp. You can always message me and then I can teach you more about folic. Okay. Have bleeding almost a month. Up to now it's not stopping. Bleeding for at least up to a month. What could be the reason? Mukwano gwafe agambye nti yakagenda mu nsonga naye n'omwezi guweze tali kuva mu nsonga. Kulwaki tali kuva mu nsonga? Kulwaki alina heavy menstrual bleeding. Heavy menstrual bleeding oba okubanga omukyala agenda mu periods n'amala wiiki esooka n'amala wiiki ey'okubiri n'agenda mu wiiki ey'okusatu nga tava mu periods. Tuba tudde ate ku hormones zaffe ze twasookeddeko. Jjukira hormones bye birungo omwana omuwala byazaalibwa nabyo. Omuli hormone gye bayise estrogen hormone, omuli hormone gye bayise progesterone hormone. Hormones zino ebbiri, estrogen ne progesterone, zibanga olaba nti kwegamba zirina kubanga zitambulira wamu, okay? So estrogen hormone webanga ebadde erinnye nga nnyingi nnyo, progesterone nebanga ekendedde, oba progesterone hormone nebanga erinnye ne estrogen nekendeera, obwongo bugenda kusensinga, and then of course ojja kulaba nti omukyala abeera mu period nga tavaamu. Ekirala tuyinza okulowooza nti kiri kuva ku hormones nga maybe muno abaana mulimu issues oba mulimu obuzimba, ng'ekizimba kye kiri okubleedinga. Oyinza okulowooza nti periods zeziri okubanga ziri kuleeta bleeding eno, okay? Toli kuva mu nsonga zo, naye ng'ate muno abaana mulimu ekizimba bakiyita batya? Ekizimba baba bakiyita a fibroid oba a leiomyoma. Ekizimba kino kibeera supplied n'emisuwa, so omusuwa ogumu we guba gwabise gusobola okuba nga gwe guli okubleedinga, okay, due to a mass effect. Kintu kiyinza okuba nga kinyigiriza ekizimba ekyo, and then of course omusuwa ogumu ne gwabika ne guba nga gubleedinga, gwolowooza periods, kumbe ekizimba kye kiri okufulumya omusaayi. Oyinza okulowooza nti periods kumbe muno abaana mulimu akazimba bakayise an endometrial polyp, kuba tukimanyi nti endometrium yeeyiika, okay? Mukyala buli lwaba nga agenze periods endometrium yeeyiika, so tuyinza okulowooza nti periods kumbe mulimu akazimba oba mulimu okuzimba. Kyandibadde kirungi noba nga mukwano gwange ogendako mu ddwaliro erikuli okumpi n'olaba dokita wo ajja kugaidinga, ajja kukola tests okuzuula exactly ku lwaki oli kubleedinga omwezi omulamba. Of course nga seerabidde dokita wo asobola okudecidinga n'akolako ne ku test eya cancer oba omumwa gwa nabaana gye tuyise a cervical cancer of the cervix screening test oba visual inspection under Lugol's iodine test eno oba ne tests endala okusinziira ku dokita wo gy'aba asazeewo, naye kyolina okutwala mu vidiyo eno oba mu live session eno kiri nti kyandibadde kirungi n'olaba dokita wo n'aba nga akugaidinga akole dokita wo ajja akola scans ezeetaagisa. Asobola okusalawo n'agamba nti kankole transvaginal oba kankole pelvic scan, asobola okusalawo n'agamba nti oba kankole kino oba kankole kino, dokita wo yajja okusalawo, naye nga the most important thing is dokita wo ajja akeberako ne ku kansa oba omumwa gwa nabaana. Kuba tuyinza okulowooza nti periods ze zirina obuzibu, tuyinza okulowooza nti hormones ze zirina obuzibu, kumbe ekizimba. Tuyinza okulowooza nti hormones ze zirina obuzibu, kumbe tosobola kumanya maybe, naye nga kirungi ne baba nga bakola ku test eya kansa omumwa gwa nabaana. Sigambye nti olina kansa omumwa gwa nabaana, nedda sikyogeddeeko, naye ndigamba nti kiyinza okuba nga kyetaagisa among the routine tests ezirina okuba nga zikolebwa, okay? Yes, so mukwano genda mu ddwaliro olabe dokita wakola test ezeetaagisa, and then of course bajja kuzuula wekiba nga kiri biochemical oba nga kiri kuva mu musaayi gwo omanyi nga kiri kuva mu hormones zo, bajja zicontrollinga waliwo eddagala lisobola okuba nga licontrollinga oba neregulatinga hormones ezo oba hormone ekendedde, then periods zijja kuddayo mu normal, ojja kuba nga olwala bulungi naku 2-3 buli mwezi, okay? So the most important thing is totula waka, genda bakole a proper assessment. In English she asked a question and she said that she's been seeing her periods for up to 1 month. She's asking herself what could be the problem, and I was saying that in most cases, she could actually think that it is a hormonal issue, because I've been talking about hormones, okay? We know very well that estrogen and progesterone, they have to balance for a woman to see her periods very consistently. But she could do the hormonal tests and yet the hormones are normal, and yet maybe there's something else causing the periods to flow. Maybe there's a mass, a swelling. We call this a fibroid. We call this a leiomyoma. Maybe there could actually be a small swelling along the endometrium, the inside of the womb. We call this an endometrial polyp. Maybe it could actually be something else, and that's why I was saying that she could actually also benefit from a routine screening test for cancer of the cervix. I'm not saying that she has cancer, but it's always very, very important to do the proper checkup, the proper workup by your doctor. So go to a hospital near you, and then your doctor will do a proper assessment on you. Queen Meshi, you are most welcome. Yes, the question is about hydrosalpinx. Hydrosalpinx inamanisha. I think it's a Swahili word, but you could actually type in English for clarity, so that most of our friends will also benefit from the question. But the question is about hydrosalpinx. The next word I've not really got the meaning, but hydrosalpinx simply means that there's actually fluid that is accumulating in a woman's fallopian tubes. Hydrosalpinx, hydro and then salpinx. Salpinx means the fallopian tube, and then hydro, basically it's something to do with fluid. Okay, now these fluids could be a result of poorly treated infections, poorly treated infections of the womb, okay, which could actually include poorly treated PIDs. And then when this fluid actually ascends or it moves upwards to the fallopian tubes, it could actually collect in the fallopian tube. Remember, a woman's fallopian tube is lengthy. Remember, a woman's fallopian tube is actually having small pieces of tissue. We call these septa. Okay, so when fluid accumulates and then maybe it's not moving out of the tubes, it actually could bring to a condition known as hydrosalpinx or hydrosalpingitis. This can be confirmed in a hospital when your doctor does a special X-ray study known as a hysterosalpingogram. This can actually confirm the location of this fluid, and then proper management will be given by your doctor. Mukwano gwaffe abuuziza alabika abuuza mu Luswayiri naye abuuza nagamba nti hydrosalpinx inamaanisha sikitegedde oba kitegeeza ki. Yes, abategeera Oluswayiri osobola okuba nga maybe mutuvuunulira, naye nengamba nti hydrosalpinx oba hydrosalpingitis kiba kitegeeza nti oluseke lugenzemu amazzi, naye okukonfaminga nti oluseke lulimu amazzi oba lulimu fluids, ebintu ebyekunganyizaamu, mukwano gwaffe ono aba alina okugenda mu ddwaliro ne baba nga bakola test oba x-ray gye bayise AMH eba esobola okukonfaminga amazzi gano galiwa mu luseke, kuba oluseke lw'omukyala luba luwanvu. Waliwo paati eno nga wakavako n'abaana bagiyita the corneal part of the fallopian tube, and then of course waliwo paati ey'omu makati bagiyita the isiphymal part of the fallopian tube, and then of course waliwo paati eno eringa ekoona, okay, egi mwerijja ne lyetuula gye bayita the ampullary part of the fallopian tube, and then of course waliwo paati eno eringa omukono ebaka egi ndene egi ne lijja ne liba nga lituula mu ampullary part of the fallopian tube. So paati eringa omukono gye bayita the fimbrial part of the fallopian tube. So waba akoze an HSG eno x-ray ejja kulaga exactly location oba ejja kulaga amazzi gano galiwa mangu nnyo okuvaamu bwe gaba nga gali mu paati eno gye bayise the corneal part of the fallopian tube. I mean, this is the uterus, okay? Assuming this is the uterus, this part here, okay? This immediate part connecting to the womb is actually what is known as the corneal part of the fallopian tube. Amazzi gano gaba gagenda ne gaba nga gekunganyiza eri mu makati ey'oluseke oba nga gali eri galeetera ne paati eno ebaka ejinga maybe bakiyita thickening nga yaguma nnyo nga tekyasobola nakubanga ebaka egi, then kiyinza okuba nga ate nakyo kireetamu complications, naye still doctor wasobola okugaidinga ku treatment ki eyeetaagisa, kuba mulimu enzijanjaba nnyingi nnyo eza hydrosalpingitis oba hydrosalpinx omuli enzijanjaba gye bayise diagnostic laparoscopic surgery. Kisobola okuba nga kikolebwako oba procedure eno esobola okuba nga ekolebwako gwe ng'omukyala ne baba nga ate enseke zino bazizibukula. Of course mulimu ne home based remedies omuli ebika ebyeddagala nzo sigenda kuba nga mbyogera wano ku TikTok live, naye nga ate basobola okuba nga ate babikuteekako oba osobola okuba nga ompeereza message nemba nga ate neeyongera okuba nga nkusomesa ku these home based remedies for hydrosalpingitis. Next question. I've been taking some tabs for stopping and Momo, you can actually send me a message. Yeah, send me a message and then we shall be able to dig deeper in your question, okay? It's okay to take Duphaston and progesterone at the same time. Is it okay to take Duphaston and then progesterone at the same time? Now, the next question is coming in from one of our friends, Tyra. You are most welcome, Tyra, to today's live session. I'm so humbled that you're still here. Yes, and you are asking about, is it okay to take Duphaston and progesterone, basically capsules or tablets at the same time? Now, specifically, Tyra, I do not know exactly what you're managing. Okay, the question is about, is it okay for a woman to take Prosta and Duphaston at the same time? We very well know that Prosta contains an active ingredient known as progesterone. Specifically, Prosta is the trade name, but it contains an active amount of a hormone known as progesterone. Basically, it is a synthetic hormone. It is artificially made, and it contains 200 milligrams of progesterone. We presume that you are actually trying to correct your progesterone hormonal levels. We presume that you went to your doctor and your doctor did the blood tests, the serum tests to really confirm that you need progesterone replacement therapy. Okay? The question, like, you've not talked about whether the tests were done or something of the sort. And then you are also saying that is it okay also to take Dufastone? Now we go back to Dufastone. Dufastone also is actually a medication which belongs to a group of medications known as progestagens, okay? Progestin specifically. It also contains progesterone. And the specific type of progesterone which is in Dufastone is actually known as dihydrogesterone. Okay? So you are taking one type of progesterone, 200 milligrams, that is in Prosta, and then you're taking another type of progesterone, which is actually in Dufastone. At the same time, you are overboosting, you are overtaking the progestagens. I mean, you are overtaking, let me try to be slow. You are overtaking the progesterones. You are taking Dufastone, then you are taking Prosta. I really don't know what you are managing, but if at all you were doing self-medication, my advice is that please do not self-medicate. You could actually cause complications, okay? Because remember I said that the two hormones of the womb, estrogen and progesterone, they have to be balancing. If you go ahead and you say, now let me boost progesterone, you've not yet confirmed whether your progesterone in the first instance was normal, because progesterone is actually confirmed on day 21 from the first day you saw your periods. If you see your periods today, you are supposed to test for progesterone on day 21. Count from today, count 21 days, and then you do the progesterone test on day 21. If you didn't do the progesterone test and you are busy taking the dihydrogesterone, I'm not accusing you, but I'm basically educating you. It's actually advisable that you first confirm with your doctor, who will really confirm what do you need of the two. Do you need the Dufastone more, or do you need the progesterone? Okay? Yes, so please avoid self-medication. When I'm talking about medications, when you are watching videos about medications, please do not self-medicate. Confirm with your doctor, tell your doctor what you're going through, and then your doctor will guide you after a proper clinical protocol, after a proper clinical assessment. In Luganda, mukwano gwaffe agambye nti alikozesa empeke za bika bibiri, alikozesa empeke. Kindly, if you have messages, please put on WhatsApp. Yes, the numbers are on my profile. I'm going to reply. Take a ebibuuzo ku WhatsApp, nja kuddamu. Yes, nemba nduddewo okuddamu mukwano tonyiiga, beera busy nnyo naye mba nja kuddamu. Okay? Yes, so mukwano gwaffe abuzizza n'agamba nti alikumira empeke eza Prosta, okay? Alikumira n'empeke eza Dufastone, alikwebuuza. Kiri nomo, kiri okay, yeyongera okubanga amira empeke zino eza Dufastone ne Prosta omulundi ogumu. Neŋŋamba nti first of all, wetuba tutunulidde eddagala lino erya Prosta lirimu ekirungo kye tuyise the active ingredient kye bayise progesterone. Naye ng'ate ekirungo kino ekya progesterone hormone eno eri synthetic, hormone eno eri artificial, bakola nkole, erimu obuzito bwa 200 milligrams bibiri empeke ya Prosta. Agambye nti alikumira n'ekirungo oba alikumira n'eddagala lye bayise Dufastone. Mu Dufastone namwo mulimu ekika ekya progesterone kye bayise dihydrogesterone. So neŋŋamba nti simanyi exactly kyali kujjanjaba kuba abuuziza just ekibuuzo, naye neŋŋamba nti simanyi exactly kikyali okujjanjaba. Naye w'okwata Prosta 200 milligrams, okay? 200 milligrams of progesterone. No take a Dufastone, dihydrogesterone, 10 milligrams each tablet. I don't know how many tablets you're taking, okay? No banga ate oli kukozesa ebika ebyo ebibiri by'eddagala, wandibanga ate weereetera embeera etali ennungi. Kyandibadde kirungi obanga gwe kennyini wagenda mu ddwaliro, wagenda pharmacy n'ogula eddagala eryo, kyandibadde kirungi mukwano n'obanga osooka n'okonfaminga ne dokitawo. Dokita wajja akola tests confirming oligezako ku replacinga progesterone, naye iyo progesterone ali atya. Ne mugamba nti okumanya nti progesterone hormone eri within the normal ranges, olina okubanga osooka n'olaba period zo leero, okay? Oba olaba period zo leero, then n'obala ennaku 21 n'okola test eya progesterone. W'okola test eya progesterone ku lunaku olwa 21, 21st day, olunaku olwa 21, test eno n'eraga nti progesterone hormone yo eri within the normal. Then kiba kitegeeza oli prosta ne Testosterone obadde omira wa bwereere oba ogenda ku overboost oba ogenda ku overboostinga progesterone abeere nga mungi nnyo mu mubiri gwo, and then of course ate progesterone ono abanga mungi nnyo then kiba kitegeeza abagenda kunyigiriza these are hormones. Progesterone webanga nyingi nnyo ogenze mu maaso n'oteekamu prosta otaddemu Testosterone, wabanga ayitiridde obungi abagenda kunyigiriza estrogen. Kati ate estrogen naye tazanyibwako, estrogen hormone tezanyibwako, buli lwogezaako okuginyigiriza ate naye ereeta obuzibu. Okay? Yes, omukyala ayinza okumaliza ng'afunye ekirwadde kye bayita endometrial hyperplasia. Yinza ogenda mu scan n'okola scan gye tuyise a transvaginal ultrasound scan oba n'okola a pelvic ultrasound scan. Omusawo wa scan n'akakutema n'agamba munnaaye endometrium yo eri mu millimeters 3. Endometrium yo eri mu millimeters 5. Kulwaki wa overboosting anonyigiriza estrogen n'agezaako okwerwanako naye n'agamba munnaaye okutte prostate otaddemu, okutte Testosterone otaddemu, kati nze kanzire ku mabbali. Then of course omukyala abanga afunye ekirwadde kye bayise endometrial hyperplasia, nderi kiba kitegeeza periods agenda azeerabira aba tagenda kulaba periods kuba muli n'abaana ejja kulowooza nti wamala dde okufuna olubuto. That's why the endometrium is thick, that's why endometrium ezimbye. Avoid self-medication mukwano, tomira ddagala just kuba olabye video nga boogera ku ddagala, gende wa dokitawo akole a proper assessment. Kirungi nnyo okuzuula kye bayise a root cause. Bwe bazuula root cause obujjanjabi buba bwangu, teweeretera complications mukwano. I think that's enough about prostate and Testosterone. But remember, osobola okuweereza ebibuuzo ku WhatsApp era nja kuba nkuddamu. Yes, so next question. I think the questions are done. AJ, you're saying that thank you so much. Thanks for appreciating. I'm really humbled. Thanks for sparing the time to really be on this live session. Nkwebaza nnyo mukwano gwange ali ku live session. Okuva lwe tutandise saa ziri meka zigenda 12. Okuva lwe tutandise paka kati nsiima nnyo siimye nnyo. Yes, you are most welcome. Mrs. Semuli, you are most welcome to today's live session. Nkwaniriza mukwano gwaffe Mrs. Semuli, nkwaniriza ku live session yaffe. Yes, remember you can ask your questions. I'll be able to reply. If you missed today's live session, by the grace of God, I'll be on tomorrow, still same time, beginning from 3 p.m. You can still join me tomorrow. Woba misinze okubanga size mu kibuuzo kyo, please tonyiiga enkya ku ssaawa 9 by the grace of God era nja kuba kwendi, then tujja kuba twongera okubanga ate tuwayamuko ku issues eza fertility. Kuba omukyala ayinza okubanga ali kufuna challenges okubanga afuna olubuto naye ng'ekiri omulemesa okubanga afuna olubuto nga kantu katono nnyo weekati naye nga takazudde. Oba tokazudde mu jjane eya fertility ebiseera ebisinga kiba kizibu. Oyinza okusanga nga maybe kantu katono nnyo ng'ate osobola okufuna omusawo n'akusomesa, osobola okuba nga obuzeebuuzo bwe wano n'enkusomesa n'enkunnyonnyola nti kano bulijjo ke kabadde kakulemesa okuba nga ofuna olubuto. Oba nga okatereezezza by the grace of God osobolera ddala okuba nga naawe ofuna essanyu ery'ezzadde ng'abakyala abalala. What are the effects of taking folic acid when you're not pregnant? I answered that question about folic acid. I actually said that folic acid is actually a very fantastic supplement. It's a very fantastic medicine, and remember I said that it actually helps boost your blood levels. It also helps in improving your immunity. Remember, you can get folic acid from natural sources. When you eat chicken liver, you can actually get some of the things which are in folic. When you eat at least some chicken, it can actually boost your what we call folate levels. Okay, when you actually eat some green leafy vegetables, we call these cruciferous vegetables, they do actually also help out. But remember, these are natural supplements. When you do take some milk, when you eat nuts, when you take some pumpkin seeds, all these things are actually very important in regulating your folic acid levels. Mbadde ndigamba nti folic mulungi nnyo, osobola mufuna mu bintu ebyenjawulo, omuli nakati, omuli ebinyeebwa bino ebisiike ebinyeebwa n'olyako biyamba ku side ey'omusajja ne ku side ey'omukyala. And then of course nengamba nti ate ebinyeebwa bino, okay, I've talked about nuts. Pumpkin seeds nazo nungi naye zirimu zinc omungi ennyo ayambako ffe abasajja. Yes, and then of course nengamba nti osobola mufuna folic oba folate osobola mufuna ne mu bintu ebyenjawulo omuli kye tuyise cruciferous vegetables. cruciferous vegetables mwe muli ebintu nga nakati, dodo. Of course osobola okulyako ne ku like any other vegetables zebasimba mu nnimiro nungi nnyo. And then of course teweerabira nti n'enkoko nayo nungi nnyo. Most specifically obubumba buno obw'enkoko bulungi nnyo, bulimu ekirungo ekisobola okubanga kiyambako okubanga ate ofuna folic ali natural nga si wampeke. Naye still kiba kirungi nnyo n'obanga omanya nti folic mulungi nnyo. Next question is coming in. What are the effects of taking folic? I've answered this question about folic. Let's go to the next question. I hope the questions are done. If the questions are still there, please ask the questions about your fertility. What are the symptoms of hormonal imbalance? Mukwano gwaffe awozizza ekibuuzo n'agamba nti omukyala amanya atya nti alina hormonal imbalance? Omusajja amanya atya nti alina hormonal imbalance? What are the signs and symptoms of hormonal imbalance? Now, let me begin with English. We know very well that for a woman to know that she has hormonal imbalance, for a man to know that he has hormonal imbalance, normally there are things that will actually show. The signs of hormonal imbalance depend on specifically which hormone is not balancing. Okay? Because if a woman has issues, or let's say a man and a woman, let me handle both at a go. If a man and a woman gets difficulties like conceiving, if a woman gets difficulties getting pregnant, and if a man experiences difficulties making his woman pregnant, then we go back to the hormones. Then we go back to what we call the sex hormones. We go back to the levels of FSH, we go back to the levels of LH, we go back to the levels of estrogen, we go back to the levels of prolactin. Okay? We go back to other hormones known as androgens. These include the DHEA, dihydroepiandrosterone. We go back to the cortisol, the cortisone. Are they within the normal ranges? The corticosterone, are they within the normal ranges? And then of course, if a woman or a man is experiencing issues of, we call these phenotype changes or phenotype, kind of like, okay, phenotype changes in simple terms. A man has a voice which is actually very small, but that's not really so dominant. If a man actually has what we call accumulation of fat around the abdomen, okay, around the abdomen, if the abdomen is basically, the man has put on weight, okay, and is trying to lose the weight. The woman has put on weight and she's trying to lose the weight. She's doing what we call intermittent fasting, okay? She's doing what we call OMAD, eating 1 meal per day, okay? But still, it's just putting on weight. That lack or that inability to lose weight, it could actually mean that maybe the weight gain or the weight is actually hormonal. The other sign of hormonal imbalance in a man is not supposed to have big breasts, but the man has big breasts. Okay? We call this gynecomastia. Gynecomastia. If this is happening to a man, the man is supposed to have like, okay, no, like, okay, kind of like the breast tissue is supposed to be small, but the breast tissue, the man is having big breasts. We go back to the hormones. Which hormone? We go back to prolactin. Why is prolactin rising? We go back to where it's coming from. The pituitary gland. The pituitary gland. Why is it sending lots of prolactin? Okay? And then, of course, if at all there are skin changes, okay, still this can actually point to hormonal imbalance. So to answer the question about hormonal imbalance, we need to be specific. Like the signs of hormonal imbalance, they are more of like hormone-based. Okay? Yeah, but generally, if a man fails to make his woman pregnant, the woman is failing to get pregnant, and then their skin changes, their voice changes, the woman is getting beards, the woman's voice has changed, the woman's body is kanyama, okay? She has done lots of gym and she has put on lots of like muscles. Normally, this could actually go ahead and raise a hormone known as cortisol. Okay, and then when cortisol hormone rises, it could actually also go ahead and suppress, or it could actually have an effect on another part in the pituitary gland, leading to suppression of the female sex hormones. These include FSH and LH. The woman might try to get pregnant, but she's not getting pregnant because of over-exercising. The man might try to make his woman pregnant, but is failing to make his woman pregnant because of over-exercising. Because the recommended time of exercise, basically it's supposed to be at least 20 to 30 minutes. But if you go to the gym in the morning and then you stay in the gym You come out of the gym in the evening. You're lifting, you're doing everything, okay? You sleep, you get back and you lift. It could actually have an effect on your hormones. So it's actually very, very important to know that hormonal signs are actually more of like connected to key hormones. In Luganda, mukwano gwaffe abuuza ekibuuzo nagamba nti signs ki eza hormones nengamba nti okumanya signs eza hormones oba hormone ki etali kubalansinga kiba kirungi nnyo ne tusooka ne tutunuulira hormone ki eba erina obuzibu kuba omukyala omwana omuwala oba omukyala watandika okufuna ebirevu then kiba kitegeeza nti yandibanga atandise okubanga afuna hormones ezitandise okubanga zikyukakyuka. Zino hormones tuziyita androgens oba hormones eziri responsible kubanga zireeta futures ez'abasajja. Naye n'omumwana omuwala ng'azaalidwa mu nsi naye agenda kubeerako ne ka hormone ako ke bayise ka androgens, agenda kubeerako ne ka hormone ako ke bayise testosterone, naye tekalina kubanga kangi nnyo. Oyinza okusanga nga normal is supposed to be maybe 0 up to 0 point something, 0 up to 0.8 kisinziira ku lab gy'oba okeberedde. Omwana omuwala wazuukuka ku makya hormone eno ey'abasajja gye bayise testosterone ng'erinnye nga nyingi nnyo, omwana omuwala agenda kufuna ebirevu bigenda kuba bingi nnyo, eddoboozi lye ligenda kukyuka, ajja gezaako okufuna olubuto tali kufuna lubuto kuba hormones ez'abasajja nyingi nnyo. Jukira hormones zino ziva ku magi, okay? The ovarian tissue releases or it secretes some male hormones, specifically the androgens. So oyinza okusanga nga obuzibu buli kuviira ddala ku magi ag'omukyala. Era wonoonyereza nnyo oyinza okusanga nga biconnectinga n'ekirwadde eky'amagi kye bayita PCOS oba polycystic ovarian disease oba polycystic ovarian morphology. Oba ogenze mu ddwaliro dokita ajja kuba akugaidinga specifically hormone ki etali kubalansinga. Signs of hormonal imbalance: difficulties getting pregnant, difficulties a man making his wife pregnant, a woman getting futures of men, okay? A man getting futures of women, big breasts in a man, okay? And then of course big abdominal fat, weight gain which is actually not going even if you're doing fasting. It could be a hormonal issue. I think that's enough about hormones. I'm summarizing more 2 to 3 questions and then we call it a day. The one breast livaamu amaazi gwe ndinyiga ko omukyala wanyiga ku bbeere lye ne livaamu amaazi kiba kitegeeza ki? That little fluid, that colorless fluid that is actually released. Ebiseera ebisinga mu luzungu tukiyita physiological breast milk release. Oyinza okusanga nga maybe otuzizo tuli okufuluma nga tuli more of physiological nga maybe tetweralikiriza ennyo, okay? Naye of course wekyeyongera n'amabere ne gatandika okuzimba n'amabere ne gatandika okuluma n'okola breast self examination, okay? Ekibato then n'okola ku bbeere bot era ne liraga nti mulimu obuntu obulinga obuyinjayinja, okay? Lumpy tissue inside your breast, then kyandibadde kirungi n'ogenda mu ddwaliro dokita wajja akola tests ezeetaagisa okuzuula amabeere gatandise okuba nga gafuna ki, okay? Is it normal oba is not normal? Ogenze mu ddwaliro dokita wasobola okukolayoko ku scan ey'amabeere bagiyita the breast ultrasound scan oba asobola okukolayoko ne ku x-ray ey'amabeere bagiyita the mammogram. Of course bino byonna bisobola okuba nga biconfirming ebifuluma nga biri normal then toba nakweraliikirira koona oba tolina kweraliikirira otuzo tuba tufuluma tubeera physiological fluid tuba tetweraliikiriza, okay? Naye oba nga tolina any other symptoms naye ng'otuzo tuli okufuluma still kyandibadde kirungi n'obanga era oconfirminga ne doctor wajja kubeera akuguidinga on the next steps. The question was about that colorless fluid that is being released and she was asking is it normal or it's abnormal, and I was saying that in most cases when there is this colorless fluid which is coming out but still there are other signs like maybe there are lumps or there are swellings inside the breast tissue, it could actually point to a condition that could actually be bringing this. And I said that when she goes to hospital, her doctor will do a proper assessment on her, including what we call a breast ultrasound scan to confirm are there lumps, we call these lumpy tissues inside the breast, okay? Are there any swellings? Is the breast changing color? All these things, if a woman sees them, it's always very good to get a second opinion from her doctor. I think that's about the breast. But remember, if a woman's breast is actually actively releasing milk, and yet the woman is not pregnant, and yet the woman is not breastfeeding, it could actually be a sign that there's something that is not right. Still, her doctor will be able to guide her on the next steps to follow. Omukyala abanga badde tali lubuto naye nga amabeere buli lwanyigako bw'ati amata gafuluma nga mangi nnyo, kiba kidda ku hormone gye bayise prolactin, yandibanga etandise okulinnya. Jjukira nayogeddeko ku prolactin nga ntandika ne ngamba nti prolactin esobola okulinnya ng'eva ku bintu bingi. Omukyala ayinza okuba nga alina eddagala lyaliko liriri okuleetera hormone eno okukyuka oba okukyankalana. Omukyala ayinza okuba nga maybe yabadde yafunye kye bayise breast stimulation, nga bamustimulatinze, nga babadde alina ebbaawe maybe during romance, hormone eno gye bayise prolactin eba nga yalinnye. And then of course omukyala ayinza okuba nga maybe alinamuko ku issues endala omuli obuzimba obutono ennyo bwe bayita bu prolactinomas. Buba butono nnyo busobola okuzuulibwa ku scan gye bayita an MRI scan, magnetic resonance imaging scan. Esobola okulaga oba mulimu obuzimba oba temuli buzimba, but it's a complex scan whereby olina okuba nga oyogera ne doctor wo, then n'azuula which pathway to follow, which algorithm to follow, then doctor wajja kuguidinga nti tukole kino tukole kino. I think that's enough about breast milk release. Next question is coming in from, breastfed for 2 years, but I stopped. Still, I don't get periods. What could be the problem? Thanks a lot for this question. She was breastfeeding for 2 years. She stopped breastfeeding, but the periods have disappeared up to now. What could be the problem? She was breastfeeding 1 year down, 2 years down. She stopped breastfeeding a long time ago, but the periods have disappeared. What could be the problem? When a woman's periods disappear for at least 3 months, 6 months, 1 year, and she does not see her periods again, if she has ever given birth, we call this secondary amenorrhea. It could actually be a sign that there's something that brought about these periods to disappear. We are looking at periods, but maybe we don't know what's happening in her neck. In the neck region, there's something small. There's like a small gland known as the thyroid gland. If the thyroid gland is dysfunctional, it's going to affect a woman's periods. She could be focusing on the periods, taking the medications for periods, doing everything, taking the microgynon and all the other medications, but yet the problem is in the neck. The thyroid gland is not good, Of course, your doctor will do a proper evaluation to really confirm why you are not seeing your periods. So the periods could also disappear due to other conditions like maybe weight gain or weight loss. Maybe she had weight, but maybe after this whole process of breastfeeding and maybe the stresses of giving birth and maybe changes in life, she gets overstressed and maybe she loses weight very fast or she gains weight very fast. All these could actually make the periods to disappear. Remember, I said that on the journey of fertility, in most cases, it could be something very small, bringing about the chaos. And yet, you need to identify that something which is very small, bringing about that chaos. And that's why you could actually send me a message and then we shall be able to learn more about your fertility. So, why the periods have disappeared for 2 years, it could actually be due to weight gain, weight loss. It could be due to excessive stress, When a woman is stressed, excessive stress, leave alone this thing of like you quarrel and then in the evening you're okay. But the excessive stress at night, people are sleeping, you're actually awake. At 2 p.m., people are dreaming, you are awake. That stress that keeps a woman awake, in most cases, that excessive stress is going to it's going to bring about the release of another hormone, a stress hormone known as cortisol. Cortisol hormone is produced from specific cells on your kidneys. Specific glands on your kidneys. We call this the adrenal glands. Specifically, a part known as the cortical part of your adrenal gland. So when cortisol hormone has been released, it travels in the blood. It goes to the anterior pituitary gland. It tells the anterior pituitary gland that, you know what, don't produce the sex hormones, the FSH, LH, estrogen, and the rest, So it could be stress related. Periods could disappear because of excessive stress. Still, your doctor will do a proper assessment, a proper evaluation to really confirm why your periods have disappeared. Once the cause has been identified, your periods will actually be back to normal. Next, your periods can actually disappear due to age-related changes. If a woman is in her she's approaching her 40s, sometimes disappearance of her periods, even though she was breastfeeding prior, her periods could disappear maybe because she actually she's actually maybe approaching menopause, but all this has to be evaluated in a hospital near you. Mukwano gwaffe abuuza n'agamba nti yayonsaako bulungi myaka 2, periods ne ziba nga zalekeraawo, naye okuva lwe yayonsa emyaka 2 emyaka 3 periods zaabula, ali kwebuuza ku lwaki periods zaabula, ne ngamba nti periods ziyinza okuba nga zaabula olw'ebintu bingi nnyo ebitakinga place. Okay, periods zisobola okubula nga maybe kiri kuva ku stress, okweraliikirira ennyo, nga maybe waliwo stress ezatuukawo, nga omanye mu bulamu temubulamu bintu byeralikiriza, temubulamu bintu bisobola kuba nga bikyusa embeera ez'omuntu. So omukyala wabanga yayita mu stress enyingi ennyo, stress eyo esobola okuleeta periods z'okubula. Ereeta etya periods okubula? Musawo Gerald yogedde ku stress nti ereeta periods okubula. Kijja kitya? Omukyala wabanga yeralikiridde ennyo, omubiri gwe gugenda kufulumya hormone gye bayise cortisol hormone. Hormone eno evaawa ku nsigo ez'omukyala kuliko obutundu bubiri butono nnyo bwe buti bulinga sumbuusa. Obutundu obwo bubiri babuyita bu adrenal glands. Bulina parts bbiri. Waliwo part gye bayita the medulla part of the adrenal gland, waliwo ne part gye bayita the cortical part oba the cortex of the medulla. The cortex efulumya hormone gye bayise cortisol. Hormone eno omukyala aba yeralikiridde nnyo, hormone eno esobola okugenda ku bwongo. Jjukira hormones communicate, hormones zoogera oba zicommunicatinga. Omukyala aba yeralikiridde nnyo, hormone eno gye bayise cortisol egenda ku bwongo. Wetuuka ku bwongo ereeta changes, omukyala periods ne zibula. N'amira eddagala, n'anywa buli kimu kyonna kyonna, n'anywa habbo, n'anywa buli kimu kyonna kyonna, naye nga periods zibuze, nga kiva ku ki? Kiva ku stress enyingi ennyo. Okay, omukyala ono wakendeeza stress, reducing stress, n'atandika okwebaka ekimala 7 to 8 hours nga yeebase. Okay, of course omukyala webanga yeebase ekimala, waliwo hormone egenda okuyiika. Hormone eno bagiyita melatonin. Hormone eno nungi nnyo, egenda nekakanya omubiri gw'omukyala, nekakanya hormone eno gye bayise cortisol, the stress hormone, egenda nekakanya omubiri gw'omukyala. And then of course omukyala ono even nga tanamira mpeke yonna ajja kulabirawo nga periods ziize. Kibeerawo nnyo omukyala maybe ali mu relationship eyo neba nga yamustressing nnyo, and then of course n'olubuto nga lwagaana. Okay, nga yali ku pressure nyingi nnyo, naye watandika relationship empya, buli kimu nga kikyuseemuko, n'afuna emirembe, peace of mind, bamutwalako out like ali so happy. Ogenda okulaba nga ate omubiri gwe gwesetting, ogenda kuwulira nti mama gundi yafunye olubuto, n'omubuuza mama gundi wagenzeko mu ddwaliro, ajja kugamba saagenzeko mu ddwaliro munaye nze nalabidde awo, musawo yakantemye nti munaye olubuto mweruli. Neewuunyiza abakyala bangi atuuka mu ddwaliro ne bamugamba nti ali lubuto, n'akaaba n'okukaaba nga abadde takimanyi nti already yafuna dde olubuto. So changes ezo kikonfaminga nti changes ez'omubiri zisobola okuba nga zi-affectinga omukyala. Kirungi n'omanya exactly omubiri gwo ku lwaki periods zibuze. Is it because of okugejja ennyo? Okiba nga kivudde kuba nti omukyala ageeze ennyo, then the solution is very simple. Alina okuba nga akendeeza ku weight ye. Okay, osobola okujja ku WhatsApp n'enkuba nga kusomesa butya osobola okuba nga losing weight. Okay, and then of course wekiba nga kibadde kuba nti yakooga nnyo, rapid weight loss, waliwo condition ey'oku losing weight bagiyita anorexia nervosa. Condition eno evira ddala mu bwongo bw'omukyala aba ayagala losing weight. Kibeera nnyo mu baana abakyasoma ba kampasa, ayagala ayambale buli bujino obutinennye nnyo nga okay, ayagala beere so small. Ebiseera ebisinga omwana oyo ajja kuba talya mmere nga waalina kulya. Omubiri gwe gujja kuba tegufuna ebirungo nga proteins, kuba jjukira proteins ebiviirako omubiri okuba nga gulabika bulungi. Okay, ajja kuba tafuna birungo bimala kuba tali kulya, ayagala kukooga. Kampasa ayagala kooga abeere mutono nnyo. Ebiseera ebisinga mu kukooga okwo oba mu losing weight ayinza okumaliriza nga ate ne hormones ze azitwaliddemu. So addamu n'ateekako ku weight, n'afuna ku nutrients, n'alya ku magi, n'alya ku byennyanja, n'anywa ku mata, n'addamu n'aba nga afuna okwebaka okumala 7 to at least 8 hours ekiro. Ekitanda kiyingire essaawa 3 oba 4, at least webake paka ssaawa 12, and then oba ssaawa 14, kisinziira ku your schedule, but you should do 7 to 8 hours of deep sleep, deep peaceful sleep. Ojja kulaba nti omubiri gwo gweregulatinga, ojja kulaba nti omukyala buli kimu kiteeredde, periods azirabye nga tamize na ku mpeke yonna. Yes, Tina, thanks a lot for the appreciation. Tina, thanks a lot. Nsiimye nnyo, webale ku supportinga, webale nnyo, webalire ddala akamuli nkalabye. Tina, thanks a lot. So badde nkyayogera ku omubiri gw'omukyala ne ngamba nti ebiseera ebisinga oyinza okusanga nga maybe kivudde ku weight gain. Wekiba nga kiri kuva ku weight gain, kendeeza weight. Kiyinza okuba nga kivudde ku weight loss. Wekiba nga kivudde ku weight loss, periods nga zibuze, tereza at least weight eyo. Okay, tandika okukozesa ku bintu ebyenjawulo omuli emmere esobola okuba nga ekuwa proteins. Mwe muli at least nemedde nnyo ku magi kuba egi lirimu ekiriisa kingi nnyo. osobola n'okusoma ku magi, the benefits of eggs. Amagi malungi nnyo kuba eggi erimu efumbe, okay? Kuba ate woba olisiise, sometimes naye nga ate the most important part of the egg, the most important type of egg is the boiled egg, okay? Eggi lino eriba nga fumbe libeeramu ebirungo byonna nga biri preserved, so olyayo at least ku magi 2 oba magi 3 malungi nnyo. Of course research oyinza okusanga bagamba amagi si malungi, gongeza hormone, gongeza oil oba gongeza essavu lye bayise LDL, low density lipoprotein, oba gongeza cholesterol mu mubiri, naye ate omubiri gwaffe gwetaaga cholesterol. Omubiri gw'omusajja gwetaaga cholesterol okukola hormone y'abasajja gye bayise testosterone. Omubiri gw'omukyala gwetaaga cholesterol avudde mu ggi okukola hormones ez'abakyala ze bayise estrogen ne progesterone. Obwedda nzogerako nnyo, oyinza okusanga nga estrogen hormone teri kubalansinga, progesterone hormone teri kubalansinga, ekiva ku ndya ng'endya si nnungi. Oyinza okusanga ng'endya si nnungi, okay? Obe like tubeera busy fena, okay? Naye olina okufiisaako ku kadde, at least nobanga at least webba n'olyayoko ku girimu oba amagi 2 kiyinza okukolera wonders nyingi nnyo. Amagi nga manyi bulungi gakolera ddala era gayambira ddala. Then of course olina okubalansinga n'olyayoko ne ku kabogoya ebiri mu bbogoya. Tewetaaga kulya bbogoya yenna naye at least 2 to 3 fingers. Bbogoya oyo mulungi nnyo, osobola okubalansinga n'onywayoko ne ku mata gaba tegakuyisa bubi. And then of course osobola okubalansinga n'onywako ne ku maazi agamala obulungi. Enywa y'amazzi etawaanya, nange musawo kenyini akugamba era olaba nti amazzi tubeera busy nnyo, naye ebiseera ebisinga tulina okumanya nti obulamu bwe busooka, so olina okubanga at least otambuleko ne ka container n'onywako ku mazzi agamala, omubiri guba gudimandinga hormones okubanga zibalansinga obulungi. Wadde ekituufu tugamba nti genda ku mpeke mira kino, naye olina okubanga otereeza ebintu endyayo, okay? Mu luzungu bakiyita lifestyle modification oba working on your diet. Oyinza okusanga nga just okyusiza endyayo, tukimanyi bulungi nti emmere eddagala, okay? Yes, osobola okwogera n'omusawo gwe bayita dietitian, okay? Aba ya specializinga mu byokulya, asobola okwongera okuba nga akukolera kye bayise a food plan oba a diet plan depending on your body type n'ebirala. So olina okuba nga otunuulira ennyo ebintu by'oli okulya. Omukyala alina okulya ku ggi, ngenda kiddamu, omukyala alina okulya ku ggi efumbe limu oba 2. Okay? Then of course omukyala alina okuba nga at least anywa amazzi agamala. Omukyala alina okulyako ku kye tuyise cruciferous vegetables, okay? Omukyala alina okuba nga at least afuna okwebaka okumala. Tetuganja of course waliwo stress nyingi nnyo mu nsi, tulina okunoonya ssente, twetaaga fees, twetaaga kino, naye at least weewaayo akadde n'ogamba nedda kano akadde kange kanebaka ekimala. Okay? Kyala alina okufuna obudde n'awummulamuko like n'okkakanya omubiri gwo n'ogujja mu mbeera eya stress. Kuba okweraliikirira ennyo, leero ndina okukola ssente zino, ndina okukola bwenti, buli lwobeera ku tension, buli lwobeera ku that persistent tension, omubiri guba gugenda kuba gwongeza okuba nga gufulumya hormone eya stress gye bayise cortisol. Kati ate jjukira cortisol, Mukama yatutonda nti cortisol hormone eno nnungi, erinnyamuko katono, maybe waliwo ekintu ekikukanze oba muyombyemuko and then all that ofunyemu obusungu, naye erina okukakana neddayo mangu. Buli lwobanga omubiri gwo guli kusensinga nti oli mu stress, weeraliikiridde eby'essente, weeraliikiridde eby'omulimu, weeraliikiridde ebya fees, weeraliikiridde ebyaki, omubiri gugenda kuba gwongera okuba nga gufulumya hormone ey'okweraliikirira gye bayise cortisol. Kati hormone eno buli lwobanga eri persistently high, then egenda kuba nga erumba na zino hormones za fertility, egenda zikuba, okay? Egenda zigamba mmwe aba fertility tuli mu kweraliikirira, kati mmwe ate mwagala ki? Tetwagala magi gakule, okay? Mmwe aba breast milk production, amabeere okubanga gajja, ffe tweraliikiridde, kati gwe amabeere ogira olindako, omukyala n'azaala bulungi omwana n'amuteeka ku bbeere naye nga tewali mata gafuluma. Ku lwaki? Stress nyingi nnyo, yatuuse okuzaala naye ng'alina stress nyingi nnyo, okay? Yeah, so kirungi nnyo okubanga tumanya nti okumanaginga stress, the best way of managing stress is actually forgiving and letting go of the past. Weesonyiwa eyakunyiiza, ne weesonyiwa embeera yonna maybe eyakuleetera obusungu obwo, n'omuntu eyakunyiiza n'omusonyiwa. Forgiving kiba kizibu nnyo, naye osonyiwa n'omwesonyiwa n'ogamba munaye nakusonyiwa, omuntu oyo n'omujja ku mutima, yakunyiiza kituufu naye n'omusonyiwa n'ogamba nti kati nkusonyiye, n'ogamba nti leero maybe kino kyenfunyeko kyekyange, Mukama kyampadde, like n'obeera content n'ogamba nedda, n'enkya nalwo olunaku nja kuddamu nkole. Kasobeera ne those simple remedies ojja kulabira ddala nti ate obulamu bwo bukyuka nga teweestressinze, nga tokuumye busungu. Ebiseera ebisinga mu nsi tubeera ne stress nyingi nnyo kuba tetwagala kusonyiwa, okay? Tetwagala kusonyiwa tusonyiwa twagala tubeere n'obusungu obwo gundo yankola bwati ogenda okulaba nga obutasonyiwa obwo buyingira mu bulamu bwo maybe wali mu relationship eyasooka n'ofunirayo ko disappointment, okay? Yes. Naye ate oba ng'oli mu relationship eno empya omuntu gw'ofunye ono omupya ate tositula busungu bw'oli ate n'obuteeka kw'ono. Okay? Yes. Wali mu relationship eyasooka, okay, abantu basisinkana ne baawukana naye ate tositula obusungu obwali mu relationship n'obuteeka mu eno n'ogamba nti kati n'ono alabika naye agenda kunkyawa, kati n'ono alabika naye agenda kukola oli bye yakola. Nedda, abantu banjawulo. Mukama alina abantu baleeta mu bulamu bwaffe nga bagenda kukyusa obulamu bwaffe in a positive way. So okkiriza n'ogamba Mukama mpadde ono mupya naye ebyali emabega byonna kambyesonyiwe, kanfokasinge ku gwendina mu ngalo oba kanfokasinge ku ono gwendina. Ebyo byokka like weweebuulirira. Okay? Wewe bakiyita meditating. You meditate on yourself. Neweebuulirira n'ogamba nti n'osiima Mukama n'ogamba omuntu ono mupya naye katukole bwe tuti as in n'omanya nti teri muntu ali perfect mu nsi, teri muntu atuukiridde, buli muntu alina at least ekiba kibulamuko naye ogamba nedda katukole ku the strength, katukole ku bintu ebisobola okuba nga bitutwala mu maaso. Ojja kulaba nti ebintu ebyo ebisinga bireetera okuba nga obeera within omubiri gwo kuba gusanyuka. Okay? Kuba hormones basically ziba nazo zisensinga nti yavudde mu mbeera ey'obusungu, kati yakakkanye, kati wuno asimayilingako, kati wuno yebaka ekimala, then hormones nga zikendeera, hormones nga zidda mu nnomo, hormones nga zitereera. Ogenda okulaba nga omukyala afunye olubuto ne bamubuuza nti mama gundi wakoze otya okuba nga ofuna olubuto? Naye ate agamba naye nze sirina nalabidde awo. Okay? Yes. Tamize empeke, tatambudde nti oba kati kangende eno naye ogenda okulaba nga afunye olubuto. So you need to work on your lifestyle in most cases. Fena tulina okuba nga twekolamu omulimo. Togamba nti kati musawo no fena byenjogerako nange era ngezaako okulaba nga nange at least mbigoberera kuba fena tetuli perfect. Olina okuba nga weetereeza buli kiseera. So I think it is 6, it's coming to 7. I'm supposed to stop at this particular moment. What causes headache during period? Nachizemu Sayana Press family. I'm on Sayana Press family planning. I had the intercourse. The next day I saw little blood. And then the question is, will she get pregnant? Okay, then she's on Sayana Press. She had intercourse. She was with her partner during ovulation, and then she saw some little blood. She's asking, will she get pregnant? Just by the mere fact that you are already on Sayana Press. Okay, that is basically a family planning method for 3 months. If this Sayana family planning method was actually given at the right time before ovulation, okay, and then you were with your partner, already the Sayana Press, already the family planning will be doing its work. You don't need to worry about maybe over this or this, okay? So you are on Sayana Press and then you are with your partner during ovulation. Already the Sayana is doing its work. Already it is in your bloodstream. Already it is in your body. So you don't need to worry about anything else. Yeah, and I actually don't even, okay. Just excuse me. Okay, sorry about that. Let's proceed. Can I ask in Luganda, Agi? Yes, Agi, osobola kubuuza. Yes, buuza ekibuuzo kyo ngenda kuddamu mu lulimi Oluganda buuza. And even like if you're okay with the Gishu language, if we have our friends who are okay with Gishu language, you can also ask obanga ogana kuteeba kiteebo ky'omu lulimi Lugisu teeba nyana kwiramu. Yes, obanga like so you can ask in Luganda, there's no problem. You can ask. I'm going to see the question. I'm in fear, hard day, in how many periods will I get paid? Sex in periods will I get paid? Okay, so the next question is coming in from a friend, and she's saying that she was with her partner during her periods, and then she's asking, will she get pregnant? When a woman is in her periods or menses, periods actually simply mean that she did not get pregnant in the previous month. So the blood So periods simply mean that she did not get pregnant in the previous month. The blood that is coming out, it's a confirmation that pregnancy did not happen. Ideally, it's not advisable for a woman to to have sex or to have intercourse during her periods, but of course, sex is an emotional subject. It's an emotional issue whereby the emotions could actually be very high and maybe you're not able to control it. I'm not accusing you. Yes, but the point is, ideally, if you are in your periods, at least you should try to be patient, and then of course you finish your periods, and then after your periods you can always be with your partner. Why? When you have intercourse during your periods, that blood can actually do what we call a retroflow. It can actually go backwards, and when it goes back, it can go and then accumulate in your tubes. It can go and lodge in the tubes. It can go and stay in the tubes. Now it will not be painful. That blood which is in the tubes, it will not be painful, but it can wait for you. It can wait for the time you try for pregnancy. Yes, and then of course it could actually cause issues. That's actually among the reasons as to why most of the women end up with conditions like fluid in the tubes. It could be old blood which had collected there when you had intercourse with your partner during your periods. So if you are in your periods, it's advisable finish your periods and then at least 3 to 5 days be with your partner. Oba oli mu periods si kirungi kubanga obeera n'ebbaawo ku lwaki kuba omusaayi ogwo gusobola okukola kye bayise retroflow kuba omukyala abanga ali n'ebbaawe alina okwebaka n'atunula waggulu. So in most cases omusaayi ogwo gusobola okudda mu nseke ne gutula mu nseke. Omusaayi guno guba gutudde mu nseke tegugenda kuluma gwe ng'omukyala ojja kuba very okay, ogenda ku mulimu okola emirimu gyo bulungi, naye omusaayi ogwo guli mu nseke ogwagendayo ng'oli mu periods n'obeera n'ebbaawo gulinda olunaku lw'ogezaako okufuna olubuto bye bikyasinza okuba nga biviirako embuto kubanga zisigala mu nseke. Ku lwaki? Omusaayi gwagendamu mu nseke ne gutuulamu. I hope I've answered that question. So if you were with your partner during periods, I don't know, but the chances of pregnancy are very low. Unless if at all what you're calling periods is actually what we call implantation bleeding. It is that last period. Already you were pregnant. Okay? Yeah, but if it's not implantation bleeding and it is real, if it's not implantation bleeding and it is real, it's real periods, then the chances of pregnancy are very low. So I'm going through the question very fast. Short answers, straight to the point, we move. Okay? Yes. Because I need to answer everyone. Okay? You will excuse the interruptions because we are near the road. So Kara Carson, hello Kara, how are you doing today? You are most welcome. What does brown old blood mean? Brown old blood. Basically, brown old blood or dark old blood, it could actually be brownish or it could be dark. It's black. In most cases, it is blood which came out. It was supposed to really be depleted. It was supposed to be over during those periods. Maybe you saw your periods today, tomorrow, and the next day. But there's some little blood that remained in there. That blood that has remained inside your womb, it can actually react with air through a process known as oxidation. Air, because the woman's womb, remember the woman's womb is a pathway, okay? Like air can go through maybe when you're with your partner. Okay, air can go through maybe when you're like maybe doing susu or kwetawaza, cleaning yourself. So that air, when it reacts with that blood which didn't get finished in your womb, it can actually make the blood to actually either become brownish or it can make the blood to be dark. Then the woman will see her periods, the blood is dark, the blood is like brownish, and then she's asking, why have the periods changed their color? Because the normal period is supposed to be, the normal periods are supposed to be actually clear red blood, fresh blood. But if the blood is actually darkish, then it means that the blood remained inside there, it reacted with air through a process known as oxidation. If you've ever seen someone maybe like a small bleed, okay, and then the blood like pours on the cement, okay, maybe you've pricked yourself or something like that, okay, maybe you've okay, but if you've ever seen blood which has like dropped on the floor, in most cases you will actually realize that after some little, like maybe seconds or after like a few minutes, when you go back to check that blood, it would have changed to black. It confirms what I'm talking about. Blood can react with air. Okay, yeah, I hope I've answered that question about brown blood. It's basically a reaction of blood with air. What causes headaches during periods? Headaches normally during periods, normally it could be due to the changes that are taking place, because when a woman is in her periods, there are chemicals that are circulating in her body. There are chemicals that are circulating in her system, specifically the pelvic part, the waist part. Okay? Yes, so those chemicals, we call them prostaglandins. They actually can cause pain around the pelvis. Omugongo gunuma, wansi wanuma, wansi wekundi. The pain, the chemicals can even move in the bloodstream because blood is always moving in the body. The chemicals, the pain chemicals can actually even move to other parts, like maybe even the whole body, and you feel sickly. Okay, a woman can be in her periods and she feels sick. A woman can be in her periods and they bring her to hospital when she's crying. Okay, they give her a painkiller, okay, injection, and then the pain goes down and the whole, like, the system goes back to normal. So it could be due to the pain chemicals bringing about the headache. But also it could also go back to other things, like maybe how is your blood pressure, because we could be talking of periods and yet maybe there's blood pressure. We could be talking of periods and yet maybe there's other pre-existing medical conditions. A woman is in her periods but she has malaria. A woman is in her periods but she's not taking enough fluids, enough water. Yes, next question. I made a pregnancy test when there are two lines. The first line was dark and the second was faint. Okay, congratulations, Shadia. Yeah, congratulations, Shadia. You did that. You said that you did the pregnancy test, and the first, the two lines, and then the first was dark, and then the second one is faint. That is actually very normal. Okay, first line is very dark, the next one is faint. It's very normal as long as there are two lines. The faintness or the darkness of the line should not actually disturb you. Okay. Okay, Justin Kigenyi, Justin, yes, on YouTube, we have a friend, Kigenyi Justin. You are most welcome, YouTube. Yes, Kigenyi Justin. Yes, we've got the first friend on YouTube. I'm so humbled, yes. Yeah, so Kigenyi, you can ask your questions on YouTube. I'm going to reply, okay? So I was talking about the faintness or the lightness of the two lines, okay? If you do the pregnancy test and the lines are faint, or one of the lines is faint, and then the other one is dark, or both of them are faint, or one is, as in, don't worry about the faintness or the lightness of the lines. Why? Because there are several pregnancy testing strips on the market. Okay, there are those that are so expensive, like the clear blue. I'm using the word so expensive because I'm talking to yes, our average person, average woman. Yes, so there are those that are so expensive, like clear blue, and then there are those that are actually very cheap. So we don't know which pregnancy test strip you used, but the faintness or the lightness of the pregnancy, of the lines, okay, on the pregnancy test, it depends on the type of the pregnancy test strip you used. It also depends on which urine did you use. Did you use the morning urine, okay, or did you use like after taking lots of fluids and then maybe lunchtime and then you do the pregnancy test? It also goes back to the testing container. If you use the container, or you went and then they used the container, maybe in the clinic, and then the container had some little water, and the container was not so dry, and then the sample was very little, yeah, it could actually bring about those changes. But of course, to confirm a pregnancy test, you need to go ahead and then do two tests. One, you could actually do what we call a beta HCG pregnancy test. The doctor will tell you about the beta HCG pregnancy test. Normal or a positive pregnancy test, which is a beta HCG pregnancy test, is supposed to be at least above 5 milli international units per milliliter. Okay, so your doctor will guide you about that. If you do the beta HCG pregnancy test and then the results are showing that you're below 5 milli international units per milliliter, maybe you scored 2, maybe you've scored 1, then most likely it is a negative pregnancy test. Why was the test strip positive and then this one it is negative? We go back to hormonal changes. Maybe the HCG hormone has gone high, but there are things that have caused the HCG hormone to rise. Your doctor will evaluate you look at a correct pathway, a hormonal pathway as to why the HCG one is positive and then one is negative. We shall talk about that in the next live session. Next question. Use clomiphene while in period, but will it work? Clomiphene. I'll go back to a caution, okay? Please, I really hope that you were given the medication by your doctor, because do not self-medicate. Now, in this particular case, you're saying that you used clomiphene while in your period. You are asking yourself, will the clomiphene work? Assuming that the medicine was given by your doctor, ideally, we know very well that clomiphene is a medication that can actually bring about the whole process of ovulation. It can actually enable the eggs to grow. But assuming that your eggs were already growing, and then you went ahead and used clomiphene, then there's a risk of complications like ovarian hyperstimulation syndrome. Mukwano gwaffe agambye nti yakozesa clomiphene ng'ali mu periods, ali kwebuuza ajja kufuna olubuto oba nedda, ne ngamba nti kirungi nnyo first of all n'obanga eddagala ly'oba okozesa lyonna dokita wo n'abanga yalikuwadde. Togenda mu ddwaliro n'ogamba mumpe kino nedda. Togenda mu pharmacy n'ogamba mumpe kino, oyinza okuleetera obuzibu. Clomiphene citrate belongs to a group of medications. We call these the selective estrogen receptor modulators. That is medical. In simple terms, it belongs to a group of medications which suppress or which lower your estrogen levels. Clomiphene lowers your estrogen levels. Okay? That's why I'm talking about do not self-medicate. When you take clomiphene like this, within a few hours, okay, you can read the leaflet inside. Within a few hours, it's going to lower your estrogen levels. When estrogen levels have lowered, the brain is going to sense that, you know what, estrogen is lowering. The estrogen is low. Then the brain will send FSH and LH. Clomiphene is going to be doing that. So when FSH and LH have been sent, they will travel in your bloodstream to your gonads. They will travel in your bloodstream to your eggs. When they reach your eggs, assuming that the eggs were not growing well, the FSH and the LH will bring about that whole process of egg growth. They will move from the primary, secondary, and then you shall get a dominant egg. We call this stimulation. Now, if you go ahead and take the clomiphene, self-medication is bad. Now, I'm trying to show you why self-medication is bad. If you go ahead and you hear about clomiphene, they're talking about clomiphene all over TikTok. Okay, clomid. And then you go ahead and you buy the clomiphene, or you go ahead and you take the clomiphene on yourself. Like in this particular case, she's in her periods, but she's taking clomiphene. Okay? Estrogen is trying to come down, and then for you, you're forcing it to go down very fast. Okay? FSH and LH hormone, they're supposed to come after you've seen your periods, after you've finished your periods. But for you, you're commanding the FSH, you're commanding the brain that, you know what? Release FSH and LH, even if the periods are still going, but make the eggs to grow. Periods are flowing, you're making the eggs to grow. You see where the discrepancies can come in from? You see where the mistakes are coming in from? Self-medication is bad. I'm going to repeat. Please do not hate me, but I have to tell you the truth. Do not self-medicate. We have very good doctors in our country if you're in Uganda. We have very good doctors if you're in Kenya. We have very good doctors if you're in Nigeria. Okay? We have very good doctors all over the world. And they are always near you. Okay? And the hospitals are near you. Please, social media is good. TikTok is good and YouTube and all that, but please, you should watch videos on social media for just learning purposes. Learn something, and then you can always go ahead and your doctor will put you on the correct protocol. Why? Because fertility can be simple if you have got the right advice, but it can also be complicated. Okay? It can actually lead to complications. So enough of that. Clomiphene specifically is supposed to actually be taken when a woman has finished her periods, at least on day 2 or on day 3. Okay? And then, of course, on day 2 or on day 3, the brain will be sensing that, you know what, it's time for the eggs to grow. So if you are taking clomiphene and you are in your periods, already what you're doing is not the right thing. Okay? So kindly visit a doctor near you, talk to them, they will take you through the proper assessment. Visit your doctor. Yes, so I think that's enough about clomiphene. Remember, there are other superior drugs, there are other superior protocols, there are other superior, there are other treatments that can be given. If you've tried clomiphene, if they've put you on clomiphene and it's not working, your doctor can step it up a bit and move from clomiphene to some other medications. We call these the aromatase inhibitors, okay? Yes, but still you'll discuss more with your doctor. let's go ahead and then handle the next question. What causes headache during periods? Joyla, I answered this question. Okay, headache during periods, I said that it could actually be due to already some pre-existing conditions. You're in your periods, but maybe there's stress. You're in your periods, and maybe there are other diseases. You're in your periods, but maybe you have malaria. You need to check those dots, okay? Check those dots and then correct those dots. I believe the headache will go. If it is fluid intake which is low, correct that. Okay, if there's malaria, let the doctor manage that. Okay, the periods will go. Okay, you can be in your periods, but at the same time you're on your medication for malaria. You can be in your period, but you're taking your medication for high blood pressure. Okay, there's something secondary causing that. Mkwano gwa fabuza nagamba nti kolaki omuto guba gumuluma nengamba nti kiyinza okubanga maybe kiri kuvako yes. Nengamba nti counselor Irene, yes. Irene, you are most welcome on today's live session. Nkutumideko Irene, webalire ddala okubeerako ku live session. Yes, about the headache part, abuuza nagamba nti ali mu periods naye ng'omuto gumuluma. Nengamba nti ayinza okuba nga kituufu ali mu periods naye nga waliwo obuzibu obulala. Ayinza okuba nga ali mu periods kituufu naye nga ate maybe mulimu n'omusujja nga guli omulumi omutwe. Ayinza okuba nga ali mu periods nga mulimu ne typhoid. Ayinza okuba nga ali mu periods nga maybe alinamuko ne maybe ne pressure. Ayinza okuba nga ali mu periods kituufu naye nga ate enywa y'amazzi ntono. Ayinza okuba nga ali mu periods nga maybe alina n'ebirwadde ebirala nga pressure. Maybe pressure eri waggulu. Pressure is a silent killer. So oyinza okuba nga maybe tochekingako ku pressure kyandibadde kirungi n'okolayoko ku check up ya pressure kuba pressure emanyiddwa okuba nga erumya omutwe. Pressure emanyiddwa okuba nga ereetera omuntu okuba nga tassa bulungi. Pressure emanyiddwa okuba nga ate ereeta changes nnyingi nnyo mu mubiri gw'omuntu. Yes, so next question. Wow, about the clomiphene, I've answered that. I want to prepare my body for conception. What can I use? Okay, then that is very good topic, preconception. Sherina, you want to prepare your body for conception. What can you use? Of course, remember, my live sessions are for learning purposes only. They are in Luganda and they are in English. So from whichever part of the world you are watching from, please be patient. You can always get your reply in English, and then also the Luganda version is also available. Yes, so she's asking that what can she use to prepare her body for conception? We call this preconception care, okay, before a woman gets pregnant. The first plan of management or the first steps you need to take if you are planning to conceive, if you are planning to get pregnant, maybe your partner is not maybe outside, is outside the country, or maybe you're planning with your partner that maybe in 3 months or in 6 months or next year. It's always very, very important that you actually first undergo the tests that need to be done. You need to do the prior test. You need to do the proper testing, the proper checkup. Before you think of what should I take, think of, first of all, begin with the tests that need to be done. These tests actually are very simple. They include tests, we call these the radiological tests, okay? Scans, okay? Specifically, your doctor could maybe order for a scan known as a transvaginal ultrasound scan, or even maybe an abdominal pelvic or a pelvic ultrasound scan. Why? To really look at the integrity of your womb, okay? Because you could be thinking of getting pregnant and yet there are issues inside the uterus. So a pelvic scan can be done by your doctor. And then of course, other tests can be done to really confirm whether your hormones are balancing. Your doctor could decide to look at FSH, LH, estrogen, progesterone, AMH. For the beginning, your doctor could decide to look at AMH alone. Still, it goes back to the clinical picture your doctor has actually maybe identified in you. And then, of course, after these proper tests have been done, then management can be given or treatment can be advised. Of course, these could include medications to optimize your fertility. Okay, you can always message me on WhatsApp and then we can learn more about these medications. So, mkwano gwa fabuza nagamba nti asobola atya okubanga ategeka omubiri gwe, ategeka okubanga abeera ready okubanga afuna olubuto, nengamba nti nga tanalowooza kumira ddagala ki yalina okumira, kirungi n'abanga at least agenda mu ddwaliro n'alaba dokita we, ate dokita we ajja mugayidinga ku biki byennyini ebyetaagisa oba tests ki ezeetaagisa o ezeetaagibwa okubanga zikolebwa. Omuli tests ze tuyise radiological tests, mwe muli sikaani, mwe muli biki okulaba HSG, enseke ziri zitya, biki byonna, those are radiological tests. Dokita wasobola okukolayoko ne ku tests endala ez'omusaayi ze tuyise biochemical tests, okay? These tests, zino tests eza hormones, kuba hormones are chemicals, Hormones are chemical messengers. So doctor wasobola okusalawo n'agamba nti katulabe hormone ziri zitya. Asobola okusalawo n'agamba nti katulabe hormone gye bayita FSH eri etya. Wogenda ng'obadde otandise okufuna akantu akanene mu bulago ke bayise kagoyita, doctor wasobola okugamba nawe kimanyi katulabeko ku hormones ez'akantu kano ke bayise ka thyroid akali mu maaso g'obulago. Okay, mabega waako wali akatundu akalala ke bayita the parathyroid gland. So doctor wasobola okukola assessment sezo n'alaba thyroid hormones ziri zitya, eddoko litandise okuzimba, otandise okufuna goyita, naye oli kwetegeka okuba ng'ofuna olubuto, naye katusooke tulabe hormones zino ez'obulago ziri zitya. Omuli hormone gye bayise TSH oba thyroid stimulating hormone. Mu nsi yonna yonna, according to the World Health Organization, normal levels eza hormone gye bayise TSH zina kubeera 0.4 up to 4.0. Naye singa results zijja nga TSH erinnye oba TSH esennyo, then doctor wajja kugamba munnayo oli kwetegeka okuba ng'ofuna olubuto mu myezi 3, naye tusooke tucorrectinge TSH. Doctor wasobola okukola ne tests endala eza obulago omuli hormone gye bayise T3 and T4. Waliwo n'endala gye bayise calcitonin naye yeddiringa nnyo ne calcium. Naye of course byonna doctor ajja kuba akola, ajja kuba akuguidinga. You get the point. Wano tuli mu kusoma omanye nti kati weetaaga kino oba weetaaga kino. Ky'oyizeemu kiri nti olina okusooka n'obanga olaba nti at least okolebwako a proper workup, a proper check-up okukonfaminga omubiri gwo guli gutya, guli ready okuba nga gusitula omwana paka ku myezi 9 oba nedda. Ebiseera ebisinga kyala afuna repeat miscarriages, buli lubuto lwafuna luvaamu. Why? Because tafunanga a proper preconception bagita batya, preconception support, preconception advice, preconception okusomesebwa. Bino bituli okola. Okay? Nafuna buli lubuto lwafuna luvaamu. Why? Because amajige AMH eri mu 0.01 agezaako okufuna olubuto naye jirijjanga nnafu. Ba wayinza okuba nga enkwaso maybe zaanafuwadda. Okay, afulumya amazzi alowooza afulumiza enkwaso nga babadde bonna, naye ng'ate ali kufulumya amazzi meereere ge bayita seminal fluid, ge gano amazzi agasooka okufuluma nga muli kweromansinga, naye ng'enkwaso zennyini ezikola omuntu zaasigalayo eri mu gundi mu kye tuyise the epididymis, eri mu stowa nga ogamba nti soda asooka n'amanve then n'ajja mu maduuka eri kuli okumpi ku kyalo. Soda wasigala eri ab'enamave ne bamukwata, then eno temujja kufuna soda. So the point is enkwaso ziyinza okuba zaasigala eri mu katundu ke bayise the epididymis, naye ng'ate musajja buli lwafulumya ng'alina mukyala we ng'afulumya amazzi meereere. Tugayita tutya? Tugayita seminal fluid. Gabeeramu ebirungo bingi omuli glucose, fructose, omuli biki byonna, naye nga temuli nkwaso zikola muntu. Wagenda mu ddwaliro ne bakola a proper assessment, basobola okuzuula nti enkwaso zino ziriwa, zaasigalayo eno wansi, then basobola okukola kye tuyise a surgical sperm retrieval procedure. Ne bazijjayo nga bakozesa empiso gye bayise a tese injection. Nga bamaze okuzijjayo basobola oziteeka mu mukyala through a procedure gye bayita IUI. And then of course omukyala asobola okuba nga ate afuna essanyu ly'ezadde. Kyala ayinza okutambula ddwaliro ku ddwaliro ng'alowooza yalina obuzibu, kumbe gwaleseeyo ewaka ye yeetaaga okuba nga ajjanjabibwa. So it's actually very good to get this proper education n'osooka n'omanya nga tonagenda mu by'okufuna olubuto biri bitya, like biki byolina okuba nga otereeza, where are the deficiencies. Obitereeza ebyo by the grace of God osobola okuba nga ate ofuna olubuto. Of course mulimu abazifuna nga tebalinnyeko wadde mu ddwaliro, naye buli lwoba nga obadde oyagala kuba nga kwate kuba etuufu olabe nti at least wabeerawo ekiba kiza ogamba bankebera ho munene yali bweti katusooke tukitereeze, bankebera pressure ngeri waggulu katusooke tukitereeze, bankebera sukaali ali waggulu katukitereeze. Ofunye olubuto naye empekeze za sukaali tozireka, ofunye olubuto naye ng'empekeze za sukaali tolina zireka. Obanga olwedde obadde olina issues ne sukaali, tuba tudda mu katundu ke bayise the gundi the pancreas kali so stubborn, kasobola okwongera okuba nga kakukyankalanya, ofunye olubuto naye ne kakukyankalanya, sukaali n'alinnya nga yajjamu embuto, sukaali ajjamu embuto, pressure ejjamu embuto. So obuzza bulungi ekibuuzo kino Sherina, and because of time ngenda kuba nkoma wano, naye amisinze enkya okuva ku ssaawa 9 paka ku ssaawa I don't know zino zigenda ssaawa emu. So okutandika ku ssaawa 9 badde nsaba enkya gezako okuuma obudde. Okay, mbaddeko okuva ku ssaawa si ssaawa 9, ntandise ssaawa 10 naye nga ntandika ku ssaawa 9 both on YouTube and on TikTok. So amisinze ekibuuzo kyo mba sikizzeemu, badde nsaba enkya jangu. They are around the questions are many. You could actually also come on WhatsApp, take a ebibuuzo ku WhatsApp, ne maybe ssaawa nga 4 oba 5 ez'ekiro nja kubeerako ku WhatsApp. Yawe mba sisobodde ndende enkya nja kuba nziramu ebibuuzo byo. Kyensaba kiri kimu, bw'oteeka ebibuuzo ku WhatsApp kuba ebibuuzo biba bingi nnyo, mbadde nsaba ogumikirizamuko oweereza ekibuuzo nesikuddamu tonyiiga togamba nti kati musawo biki like no oyo gumikirizamuuko kuba like ebyokuba nga nkolako nabyo bingi nnyo. Otherwise, thanks a lot for sparing this time and then of course joining me on this live session. I'm called Gerald Massa and I'm a fertility coach. I'm certified by the American Society for Reproductive Medicine, and I'm also licensed to practice and as a fertility coach. And remember, you can always ask me all your questions, and then of course let me see you tomorrow at exactly 3 p.m. That is after lunch, okay? 3 p.m. Please keep time. Kuma obudde kusaba mwenda zennyini enkya tujja kuba tutandika tweyongera si kutandika tujja kuba tweyongera ne live session yaffe nga twongera okumanya fertility eno eri etya kumira bumezi mpeke oba kutereeza n'ebintu ebimu. Okay, yeah, so this is actually what we call the functional part of fertility coaching. So kambalabe enkya mwebalire ddala mikono gyaffe ababaddeko Queen Mariam, Mafa, and then of course Maggie, Mrs. Magembe webale nnyo okubuuza, and then of course besize if I have not replied, please tomorrow I'm on the live session tomorrow by the grace of God. Tomorrow at 3 p.m. please come, do not miss. Come with your questions, okay? Whether you are inside Uganda or you are outside Uganda, you are in Nigeria, South Africa, yes. Maybe you are outside, maybe you're far away. You don't need to like really maybe stress yourself. Just prepare your questions tomorrow at 3 p.m. We shall begin from there. Have yourself a fantastic evening. God bless and bye-bye.